formally wish good morning to all in Harris Hall and welcome those joining us online. I'd like to call the regular meeting of the Lane County Board of Commissioners to order. It's Tuesday, July 29th, 2025. Our flag folding, we're going through our flag folds as an inspirational moment. There's 13 folds, each representing an important sentiment and inspiration as we hold our country in high regard. Folds 10 and 11. Fold 10 pays tribute to the fathers, for he too has given sons and daughters for the defense of our country. And fold 11, in the eyes of the Hebrew citizens, represents the lower portion of the seal of King David and King Solomon and glorifies in their eyes the God of Abraham, Isaac, and Jacob. And those are the 10th and the 11th folds of our flag. Good morning to my colleagues whom I serve alongside. Thank you for serving with me. And to you, Mr. Rickoff, our Assistant County Administrator, welcome to the table, sir.
Thank you, sir.
Is there any adjustments to our agenda?
No, there is not.
Any emergency business, sir?
No, sir.
All right. Pleasure. Great. Thank you. We'll move to our item 3 in our agenda, which is our public comment section. Public can speak here in person at Harris Hall or online. The time is limited to 3 minutes, and we'll ask you to please watch the clock up here on the screen and stop at the 3-minute mark so we can be equally fair to all. You can also submit public comments via our website in at least 24 hours ahead of our meeting to be included in each weekly meeting packet. We respect your First Amendment rights as a tool to address your government with grievances and opinions, but we also admonish you to do so in a civil manner and to be respectful in expressing yourself. If you wish to come to the podium, this is where we speak right here. I'll call your name and person that's on deck. The first person on the podium is Bill Kloos, followed by Joan Tompkins. So please.
Thank you, Chair. Commissioners, it's an honor to be first. I'm Bill Kloos. As usual, 375 West 4th Street in Eugene. You have a staff memo on this afternoon's agenda relating to legal lots, recurring theme. It lists about a half a dozen reasons why there's so much legal lot litigation in Lane County. Looking at those, none of them really strikes me as being particularly unique to Lane County. But the problem is real. Lane County was involved in 2/3 of all of the legal lot litigation in LUBA over the last 4 years. The rest of the state was the other 1/3. So there's something different about Lane County. Your housing report from 2024 is right that something is broken here. There's no magic wand to fix it. You are stuck with the basics of legal lots. It just involves looking at deed history and historic regulations. But there is a lot you can do to improve the situation. You can improve the process, you can change the burdens of proof, and you can limit the people who are involved. The bones of reform are stated in your 2024 housing report. There's just a handful of most significant suggestions, I think. The first is change the process. The current process sends the message to property owners, quote, you have the burden of proof that your patch of dirt is a legal lot standing alone. If you guess wrong, reapply and guess again. The message should be, from the county, let's figure out what legal lot your patch of ground is a part of. And if it's not a legal lot standing alone, here's how you can make it so. And those are two fundamentally different attitudes. The second one's better. Second, confirm common sense presumptions to be applied to legal lot decisions. Here's probably the most important one, quote, real estate transactions are regarded as legal if that is technically and legally possible, quote. Sound common sense? That's your presumption, stated in 1998 from the Tarjoto case and affirmed by LUBA. The director doesn't apply it. The hearings official doesn't apply it. I don't understand why. Kind of has a hint of insubordination about it. So you need to put that presumption and other common sense presumptions into the code to get their attention. Number 3, restrict the notice of the process to actual stakeholders. For gosh sakes, who are the stakeholders, the real stakeholders in legal lot proceedings? It's the property owner and it's the neighbors. Nobody else has a real stake. So if you're going to amend the code, the instruction to staff should be crank the participation down for legal lot proceedings absolutely as far as state law allows. I am out of time. Thank you very much.
Appreciate your comments very much, sir. Joan Tompkins, followed by Sarah Coleman, please.
Good morning, Commissioners.
My name's Joan Tompkins. I'm a licensed clinical social worker who's worked in this community for over 20 years, serving our most vulnerable community members. I'm currently the Director of Behavioral Health at Peace Health Medical Group. I have extensive experience as a clinician serving in crisis services, inpatient psychiatry, child welfare, dual diagnosis services, and a variety of outpatient services. I've seen firsthand the urgent need for a more responsive, compassionate, and coordinated system of care in Lane County. That's why I'm proud to speak in support of our new co-located behavioral health campus. It won't be just a facility, it will be a lifeline. It means that when someone is in crisis, they'll have immediate access to stabilization, assessment, and treatment in a safe and therapeutic environment. It means families won't have to navigate fragmented systems and wait days or weeks for care. It means our community will finally have a full continuum of behavioral health services from crisis to recovery right here at home. Importantly, this campus will also help keep patients out of the emergency department, which increases access to the ED for community members experiencing emergency physical health issues. By serving behavioral health patients in a therapeutic and healing environment, we not only improve individual outcomes, but also reduce the strain on our emergency services. This benefits the entire community by ensuring that people in crisis receive the right care in the right setting, while preserving emergency resources for those who need them most. It leads to better health outcomes, more efficient use of public resources, and a stronger and more resilient healthcare system. Co-locating the Crisis Stabilization Center and our acute care psychiatric hospital on the same property is a critical component of this vision. It allows for seamless transitions between levels of care, reduces delays in treatment, and ensures that individuals receive the right intensity of service at the right time, all in the same location. This integration fosters better communication among providers, enhances continuity of care, and ultimately leads to more effective and compassionate treatment for those in crisis. The location of the campus is also ideal. It offers excellent access for law enforcement and mobile crisis teams, ensuring timely and coordinated responses to behavioral health crisis. Centrally located within the community, it provides equitable access for residents across urban and rural areas alike. To our neighbors and local businesses, I want to assure you this facility will be a good neighbor. With extensive discharge planning, strong community partnerships, and a focus on safety and dignity, we're committed to ensuring that this campus enhances, not disrupts, the community.
Thank you so much. Appreciate it. Sarah Coleman, followed by Adam Bercy, it looks like. Forgive me if that's wrong.
Hello, my name is Sarah Coleman. I'm an emergency medicine physician. Excuse me. I've worked in the community for close to 23 years now. I'm here representing my group, Eugene Emergency Physicians, which has been in contract with Peace Health for over 30 years as a group. I'm here to say that we need help. We see people in crisis, and I feel like having a stabilization center would help us provide higher quality of care. I am a great emergency medicine physician, but we cannot do and take care of the people that we have with the services that we have available right now. It would break your heart to walk down our psych hallway and see adolescents and psych patients sitting in windowless rooms in paper green scrubs on a mat on the floor for sometimes days, for adolescents, sometimes weeks on end. And I challenge you that this is not the way we should be providing care to our most vulnerable population. I'm sure everyone has tried to go to the emergency department, or has someone you love tried to go to the emergency department and waited hours to be seen. Part of the issue is we're boarding psych patients for days on end in rooms, and so we don't have those rooms available to take care of other medical needs. This facility would be close enough to Riverbend that we could easily take care of people with medical needs. And that's why I think it's important that it is close by to Riverbend, because psychiatric patient also has medical needs that they may need to be taken care of, and we would be close by to help manage those emergencies. I don't have a lot to say other than I'm begging you, we need help, we need this facility, And we can only do so much with the structure we have at Riverbend now. And this is so needed. So I urge you to really consider the needs of the community in where we're locating this facility. Thank you.
Great, thank you. Adam Bursey, followed by Grady Lehman.
It's Adam Birch. My handwriting is quite bad.
Thank you, sir.
Because I am a doctor, so. Thank you, commissioners, for giving us the opportunity to talk to you. My colleagues already have told you how important they feel that this center will be, because it's not just, one building and another building. The idea is that we have a place for patients to go, for our community members to go, for our family members to go to get the services they need. I'm the medical director for inpatient behavioral health services at Peace Health. I'm working in the old University District Hospital, what used to be a parking lot there, and we're doing our best, but we need this space. Lane County needs this space. Our communities need this space. Yes, it's to get patients out of the emergency room so that patients with emergency care needs can be seen, but also so that these patients, these community members, can start receiving the treatment they need. Because most of the time, that can't happen in an emergency room. And sitting around for days, sometimes weeks, in an emergency room is absolutely terrible for these people. It is not good for them. And we're often very, very full already. So having a 90-plus bed hospital for psychiatric patients, especially co-located with these county services, which are going to improve everything for these patients, that is so key. I cannot emphasize it enough, how important it is that we have these services available. Every study we've done, heck, just look at the community, we can all see how needed these things are. Now, the location that we're trying to use is excellently located because it's not far from the hospital. Because this is not going to be a full emergency room, and patients still have medical care. And we don't want them to take, half an hour to get to an emergency room from our place if needed. But if they're just down the road, excellent. And conversely, if a patient goes there instead of comes directly to us and they're like, oh, just go right down the road. It's much easier for them than saying, okay, well, you're going to take a left and then you're going to take a right and then you're going to go for 15 minutes that direction. They're already in crisis. They don't need anything extra. We want to make this as simple as possible for them. I very much appreciate your time. Thank you.
Thank you. Grady Lehman, followed by Cliff Harold.
Good morning. I'm Grady Lehman. I'm the Director of Planning, Design, and Construction for Peace Health, located at 1200 Hilliard in Eugene. Thank you for the opportunity to speak today. I'm here to discuss the property around the Riverbend campus and our long-term goals. When Peace Health first purchased the property in Springfield, we had a 100-year vision to provide excellent health care to the community. And I actually think that vision is a little small. We need to be thinking 200, 300 years down the road, which is difficult to do. At the time, if you envision this with me, we had our property in Eugene. We had maximized it to its current capacity, and we outgrew the space. That process took about 5 decades, so just 50 years. The status today at Riverbend is we're out of space. We have 1 million square feet that's completely full. We currently have 4 large projects that are underway. Once completed, those renovations help bring 27 new beds to the hospital. Those are beds that are definitely needed. One of our 4 projects is remodeling our existing ED. It's hard to believe that after 1.5 decades, we already need a remodel. This remodel will help increase our throughput and help more patients be seen in a timely manner. We're also excited about our new inpatient rehab facility that's located near our Annex campus. When this opens, it will add 42 rehabilitation beds. It's difficult to determine what the next 100, 200 years for healthcare will require. However, the demand for healthcare systems will not decrease. The need to expand our hospital is inevitable. The land around the hospital needs to be reserved for service lines that have direct access to acute care facilities. Those services that need direct line to imaging, cardiology, surgery suites, and the ED. The highest and best use of the land surrounding the hospital should be reserved for supporting acute care at Riverbend. The inpatient rehab facility did not require support to those acute care spaces. Our current existing behavioral health doesn't have access to those services immediately, and the new Timber Hills Spring facility also won't require them. So I respectfully request that the board supports the purchase of this real estate on Industrial Way. Thank you.
Thank you. Cliff Harold, followed by Alicia Beamer.
Thank you, Chair Lovell, Commissioners. My name is Cliff Harold. I'm the Manager of Security Services for the Oregon Network of Peace Health. As you all know, prior to this employment, I spent 35 years as a member of the Lane County Sheriff's Office. The last 6 of those, I had the honor of being the sheriff. And so I was part of the Lane County leadership team that back in 2019 identified a crisis stabilization center as the need for our community. And we started working towards that goal 6 years ago. As the sheriff, I had many opportunities to speak to this body as well as to the public about the need in our community, about the many family members I talked to throughout my career who were desperate to get help for their loved one who was on a destabilized path, but they could find no help. These family members eventually find themselves hoping for an arrest, thinking that maybe then their loved one will get help. We know the criminal justice system is not designed to provide that kind of help, despite the efforts we made at the Lane County Jail to do better by the folks that were in custody that needed behavioral health help. I'm a couple of months into my new work as a security manager for Peace Health. I have a much clearer view now of the emergency departments, how they're impacted by folks who are in the midst of crisis, and how this is also not the best place to be able to provide the stabilization that's needed. The reality is there's a lot of activity going on in the emergency department constantly, 24/7. Has sort of an energy in the air that you can feel when you're down there. And while it's not the same as being in jail for sure, it's also not the therapeutic environment for someone in a behavioral health crisis. Additionally, there's simply insufficient space to serve the volume of need in our community, which results in individuals boarding in our emergency department rooms for days or even weeks before they can be transitioned into the next level of care. I'm confident you all already know the need for these services in our community. We've been talking about them since 2019. The question is this the right place for those services? And my response is, this is better than we were hoping for in 2019 when we first started talking about this. This proposed location with its easy accessibility and ability for both the stabilization center and the new psychiatric hospital to be co-located, providing the opportunity for partnership of services between the county and Peace Health is frankly something none of us dreamed about in 2019 when we first started this conversation. I can personally attest to you that Peace Health has made a strong commitment to a safe environment through investment in a robust security program and purposeful and intentional engagement with neighbors and local law enforcement agencies. I believe the relationships Peace Health has built with neighbors around the current behavioral health unit, which include both Bushnell University and University of Oregon, is a testament to that commitment to a safe environment to deliver and receive care. Our community is on the path to being able to do better, to have a resource when family members call seeking help for their loved one who is on a path towards destabilization, to help before it gets to the point where the family gives up in hopes that the criminal justice system will provide help. This is an opportunity, a special opportunity, right in this moment. And I urge you to vote yes to continue moving us forward. Thanks.
Thank you. Alicia Beamer, followed by John Crowder.
Good morning, Commissioner Lovell and Board of Commissioners. My name is Alicia Beamer. I'm the Chief Administrative Officer at Peace Health River Bend, and it's my honor to actually close out Team Peace Health today. who are voicing a really strong in support of the purchase and sale agreement for real estate purchase property on International Way to co-locate the Lane Stabilization Center and Timber Springs, a proposed 96-bed inpatient psychiatric hospital. Last fall, the board collectively supported conducting due diligence on this property. It not only signaled to the community and the state that Lane County is dedicated to bringing vital mental health services to our community, but it also reflected the strong partnership between Lane County and PeaceHealth. This project presents an opportunity to engage partners with specialized expertise such as Connections and LifePoint, whose involvement is critical in developing sustainable and comprehensive and high-quality care. These organizations can't do this alone. To truly deliver the comprehensive, life-changing behavioral health care our community needs, all 4 organizations must come together, bringing their talents, expertise, resources, and their passion. By uniting our efforts, we can rise to the challenge of mental health crisis that we're experiencing here in Lane County, while balancing a shared sense of stewardship to make a lasting impact for generations to come. PeaceHealth and Lane County representatives have engaged in meaningful discussions with numerous local and state organizations, as well as community members. We embrace the opportunity to continue these discussions. As these collaborations, they are essential to the success of our programs and really have proven to be invaluable, most recently demonstrated by the numerous letters of support from all over Lane County, many of which helped to secure the capital funding for the Lane Stabilization Center. Today, we stand at a pivotal milestone. You've heard from my colleagues and experts today. The need for these life-saving services is urgent. We have a solution, a comprehensive plan, and an innovative service delivery model designed to address a critical need within our community, but we must act quickly. We appreciate your courageous leadership and support approving the completion of the purchase of real property. Together, we have the power to transform lives and build a healthier, more resilient community. Thank you.
Thank you. John Crowder, followed by Dre Charles.
Greetings, Commissioners. I thank you for your service to Lane County. John Crowder, Santa Clara resident. Related topic followed by is the Navigation Center. As an employer in Lane County for years, often I would have an employee make a mistake. I would encourage the employee to learn from their mistake, to do not do it again, and move on. I believe there is some applications here today. Last week, you voted to support the lives of 75 people by renewing the contract with the Navigation Center, rather than supporting the safety of 29,000 residents in River Road, Santa Clara. For weeks, I've tried to wrap my head around the concept of the Low Barrier Navigation Center, and I cannot come up with a rational way to support it in a residential community. For me, it is all about safety. Having a low barrier facility in a residential community is a threat to the community's safety. Residents of the Navigation Center and the demographics it attracts are a detriment to the community. That is never going to change as long as the Navigation Center is open on River Avenue. After I spoke before you last week, I went to the Eugene Airport to board a plane. I had to show my driver's license and proceed through security before boarding the flight. Why did I have to do that? Because our government recognized there was a safety issue and they had to correct an unsafe situation. They knew that you cannot have individuals with questionable behavior flying on airplanes. TSA law enforcement officers now provide safety for passengers. They took action and corrected the problem. Same application here. You have a problem, you need to correct it. Lane County made a mistake by originally placing a low barrier facility in the River Road Santa Clara community. There lies the problem, and you have the power to correct it. Take action, and I propose the following. Require Equitable Social Solutions to use their own funds to contract with the City of Eugene and/or Lane County Sheriff's Department for 24-hour on-site security with a public law enforcement officer to replace their current security. This plan is similar to the plan you adopted last week with the Army Corps of Engineers. Do this and it will be a deterrent for drug activity in and outside the navigation center, as well as the commercial business in the area. Number 2, adopt Plan B that was presented 3 weeks ago to sign the contract for one final year only and with the navigation center closing in its current location on or before June 30th, 2026. Support your constituents by amending the contract you signed last week with these 2 changes. Thank you for your time.
Thank you. Dre Charles, followed by Chloe Longworth.
Good morning, Commissioners. My name is Dre Charles. I'm the Executive Director of the Eugene Springfield NAACP here in town, and I'm here to speak to you a little bit about our mounted posse. So the racial implications of a mounted posse are rooted in a long and painful history of racialized violence, white vigilantism, and systemic oppression, particularly against Black communities and other marginalized groups in the United States. In the U.S., it came to describe groups of deputized civilians, almost exclusively white men, summoned by sheriffs to enforce the law. But in the antebellum South, these formations were inseparable from slave patrols, armed groups tasked with hunting, capturing, and punishing enslaved Black people seeking freedom and resisting control. Mounted patrols on horseback became potent symbols of racial dominance. These groups were not merely enforcing laws, they were maintaining racial hierarchy. After the Civil War, these formations did not disappear. They morphed into vigilante militias, including early versions of the KKK. They wielded the veneer of law enforcement to justify racial terror, targeting Black Americans, upholding segregation, and violently resisting civil rights progress. This history is not abstract. It is not remote. It lives in the American subconscious, especially in Black communities, as generational trauma. When Lane County continues to operate and deputize an armed mountain posse today, it invokes that legacy. It signals that you either don't understand the weight of that symbolism, or worse, that you're willing to ignore it. We cannot claim the mantle of progress while preserving the machinery of oppression. A mounted posse in name, structure, and function is not compatible with the vision of a just and equitable county. It is a relic of white supremacy masquerading as public safety. And its continued operation is a betrayal of your stated values. It's time to retire the mounted posse. Thank you.
Thank you. Chloe Longworth, followed by Sue Barnhart.
Morning all, my name is Chloe Longworth. I use she, they pronouns, and I am a representative of Trans Alliance of Lane County. I would like to talk about the Lane County Fairground event that happened this past weekend. At the Lane County Fair on Sunday, there was a booth set up by the Lane County Republican Party. That party was selling merchandise representing Alligator Alcatraz. Alligator Alcatraz is a concentration camp in the United States of America. They have inhumane housing conditions, and people all over the country are being kidnapped and transferred to this concentration camp. Promotion of the concentration camp turns the topic into a laughing matter and allows for more and more people to be compliant with such a horrible facility. This is not okay. There was a protest to bring awareness to the evil that is being promoted within the Lane County Republican Party booth on Sunday, during which protesters wanted to use chalk to exercise their First Amendment rights. The Lane County Event Center staff made up a rule on the spot that said that the protesters could not chalk on the ground outside. The event organizers made multiple false claims that there have been a long-standing rule prohibiting the use of chalk on the ground. Members of the protest have verified that there is no such rule, and when confronting the event organizers doubled down on their false claims. The event staff need to face repercussions for their false claims and the restrictions of the First Amendment rights that they are encroaching on citizens, as well as repercussions for allowing the promotion of a concentration camp here in Lane County. Thank you for your time.
Thank you. Sue Barnhart, followed by Daniel B.
Hi, Sue Barnhart, 1439 West 4th Avenue. Pat Farr is my commissioner. I want to thank you all for all your service to our community. And I would like to speak on the same topics as the two people who so eloquently expressed themselves right before me. We're a county that respects people. We're a county that's a sanctuary county. It's in a sanctuary city, or the city's in the county, and we're a sanctuary state. We need to respect all people. Of course, there's the right to have free speech, but hate speech, which is what I think was happening at the county fair with the selling of those T-shirts, I personally am against that. And people certainly have a right to protest against something so awful going on. So I just wanted to have you take the time to figure out how to change policies at Lane County so that it's respectful of all people. I mean, I know many people love riding horses, but that's a little different than having mounted posses. And people have the right to express free speech, but that's a little different than hate speech. Thank you.
Thank you. Daniel B., followed by Rose Wildy.
Hi there, Daniel Basaraba. Most of you are familiar with my long-winded emails regarding my case with the legal lot verification process. I wanted to echo what Bill Cluse said earlier. The process is broken. There's a process in place that allows administrators to ignore legal precedent, statute, county code or law. Their errors cost me about $75,000 in extra legal fees, only to be later remanded by LUBA. So I'm one of the 2/3 cases that was sent to LUBA and won, but at a great expense. $75,000 could go a long ways towards a lot of other things. I'm not saying that I'm poor or destitute, but if I had your money, I'd throw mine away. This is an extreme case. I can't imagine other people having to go to this level on a regular basis. But what Bill said, 2/3 of the state's LUBA cases come from this county and this staff, this director. There were numerous times throughout my case that my attorney asked for the director to elevate my case to the board. You all know I came and begged the board to come and hear my case and hear my appeal. I think that had you guys been willing to do something on a citizen's behalf, maybe my bill would have been $20,000 instead of $75,000. It's shameful what's going on. You know, for me to file a lawsuit, it would be, again, my property tax money being used against me with attorney's fees. You know, it's a crazy process. This is broken. I hope you guys do something later today to really dig into this. So thank you.
Thank you. Rose Wildy, and then we'll go to our online queue.
Hi, good morning. I'm here representing the Coordinating Council and 900 members of the Springfield Eugene chapter of Showing Up for Racial Justice. We are outraged by the racially biased crime perpetrated by current and former members of the Lane County Sheriff's Mounted Posse and their associates during the illegal assault and detainment of Keviante Hill outside the Lane County Fairgrounds in 2023, described in Mr. Hill's recently released lawsuit. Mr. Hill was attending the fair when he was accosted by volunteers of the Mounted Posse, including the former Sheriff Byron Trapp, who were not dressed in law enforcement uniform. They did not identify themselves as law enforcement and attempted to take hold of Mr. Hill's arm. Mr. Hill is a young black man, and the fair security and mounted posse appeared to racially profile him as a suspect in a gun incident at the fair the previous day, despite not matching the description of the suspect or victims or attending the fair the previous day. Mr. Hill's lawsuit also describes the racist history of the mounted posse, eloquently discussed by Mr. Charles Dray previous. Mr. Hill was also intimidated by this encounter and left the fairgrounds, but the posse members pursued him from the fairgrounds in a golf cart, tried to ram him, according to the lawsuit, and subsequently assaulted him off-site, pinning him to the ground with a knee while Mr. Hill was experiencing an asthma attack and begging for release so he could breathe. Sounds familiar. The mounted posse not only is only empowered to support traffic safety and on the fairgrounds, so the pursuit and detainment of Mr. Hill were outside their authority, by my understanding. Mr. Hill did seek justice and repair for his injuries, and the FBI and Oregon Department of Justice investigated these claims. However, no local entity chose to investigate, nor held any individual or organization accountable for this egregious abuse of force. The Department of Justice did find evidence of a racially biased crime, but the district attorney at the time took no action and destroyed the records, according to the lawsuit. Furthermore, the mounted posse was present at last week's fair with no apparent corrections or oversight or training. Surge members were also very disappointed to see the vendors selling those T-shirts celebrating the abduction and confinement of immigrants at a Florida concentration camp. Immigrants denied basic due process or access to lawyers. As Chloe described earlier, the fair management claimed these were protected under free speech, First Amendment protections, but protesters' speech was not. So this seems to be a part of a pattern of exclusion, racism, and intimidation openly supported by fair management. We support calls to end the relationship with the mounted posse, to compensate Mr. Hill for the harm he experienced, and additional financial and policy changes to assure Lane County will have no part in further racial terrorizing in our community. Everyone should feel welcome and safe at the fair. Thank you.
Thank you, Rose. Now, Jessica, to our online queue, I think we have two folks there, or go ahead.
Yes, Chair, thank you. For those joining us virtually, if you would like to give public comment, please raise your virtual hand now. Mike Reeder, would you like to be on camera for your comments?
Yes, please.
Just one moment. It will take me a moment to perform this on my end. I am promoting you to a panelist. Please accept that. And you can turn on your camera and your audio.
Good morning. Can you hear me?
We can hear you, but we cannot see you.
Okay.
There. Thank you. We can see you and hear you, and you can begin when you're ready.
Thank you. Chair Lovell, commissioners, my name is Mike Reeder, and I come before you today to echo the sentiments that were conveyed by Mr. Close and Mr. Bazaraba regarding Lane County's legal lot verification process improvements. That's going to be an agenda item for you today, I believe. I did want to bring your attention to a couple of things. One is that the planning director has sought board review of the Choctaw legal lot verification denial by the hearings official. I represent Ms. Choctaw, and we did not seek board review of that denial. And the reason is because the denial was actually, in our estimation, the correct decision. We believe that my client can go through the validation of a unit of land process separate from the legal lot verification process, which is why we did not appeal or did not seek review by the board or appeal to the Land Use Board of Appeals. However, since staff has asked you to review Choctaw, I come before you today to seek board review of two other hearings officials decisions that we think were incorrectly decided. Those two are the CSC Holdings LLC hearings official decision and the Jones McCann non-farm dwelling decision, which includes a legal lot component, but also is a hearings official decision that applies the Rural Comprehensive Plan policy 11, big game range, to non-farm dwellings inappropriately, we believe. We believe that this is has countywide significance and should be elevated to the board. And I'm at this time seeking to have the planning director seek review by the board. I come before you today because the legal lot verification process is on your agenda and because the Choctaw decision has been appealed, or I'm sorry, has been requested to be heard by the board. So should you hear Choctaw, you certainly should be hearing CSC Holdings and Jones McCann. And I'm happy to provide more detail. I realize these are quasi-judicial process, and coming before you is seen sometimes as ex parte contact. However, I do this in full transparency in front of the board, and any party who wishes to be a party to those can review this video. So I seek your support in reviewing those legal lot verification applications, CSC Holdings and Jones McCann, and I thank you for your time today.
Thank you. One last call for those joining us online. If they would like to give public comment, please raise your virtual hand. Chair, I see no further hands raised. I return it to you.
All right, thank you very much. That concludes our public comment for the day, unless we have anyone online that didn't have a chance to sign up. We do have a little bit of time. Okay, seeing none, we'll move forward to our consent calendar. Thank you very much, everyone, for coming this morning and giving public comment. It's very important, and what you said was very important to us, and we all took notes. Thank you again. Consent calendar is all items here are listed routine by the Board of Commissioners and will be enacted by one motion. There will be no separate discussion of these items. If the discussion is desired, that item would have been removed from the consent calendar and would be considered separately. Details on each of these items can be found in the blue links attached to the items' descriptions with our agenda online. I'm looking for a motion to approve the consent calendar.
Chair, I have a motion. I move to approve the consent calendar for July 29th, 2025.
Thank you. Do I have a second?
Second.
Thank you. It's been moved by Vice Chair and seconded by Commissioner Buck to approve the consent calendar. I'll call for the vote. All those in favor signify with an aye.
Aye.
Consent calendar moves forward 5-0. Thank you very much. For our fifth item on the agenda is our county administration item number 25072908, authorizing the county administrator to complete the purchase of real property in Springfield, Oregon. And with us, I believe we have Emily Vario, our Assistant County Counsel, and it looks like David Ward. Welcome back from vacation, our Capital Planning and Facilities Manager. Whenever you're ready, you can start your presentation to the board, and thank you for joining us today.
Thank you, Chair, Vice Chair, and Commissioners. I just want to take just a second to acknowledge and thank our Peace Health partners this morning for their public comment related to this agenda item. So for more than a year, we've been working to find the most suitable location for the co-located Lane Stabilization Center and the inpatient Timber Springs Hospital. And this agenda item requests authorizing the county administrator to complete the purchase of real property in Springfield. I think you all, I just want to provide a quick summary of where we are today relative to the work sessions that you've had recently on this item, as well as the other presentation last week. The site for the proposed Lane Stabilization Center was identified, and the county entered into a purchase and sale agreement with the seller as approved by the board on October 15th, 2024. Since then, staff has been working with consultants to complete necessary property due diligence items. Those items include, but are not limited to, a National Environmental Policy Act assessment, a threatened and endangered species study that's required by U.S. Fish and Wildlife Services, as well as the National Oceanic and Atmospheric Administration departments, identifying species and fish habitat in this area, It also includes Phase 1 environmental site assessment geotechnical report studying the geotechnical qualities of this particular parcel, as well as a Phase 2 environmental site assessment that identified any pesticides or other heavy metals in the soil that may need remediation during the project process. Second, we performed a land use planning services and transportation study for this parcel and the adjacent traffic corridors directly adjacent to this property and also in the vicinity to determine if there's any issues regarding land use specifically and any other issues at a high level on transportation. Secondarily, we requested a traffic impact analysis that was performed and that further identified areas of intersections and other travel corridors relative to this project. Fourth, we performed a land use planning services and transportation study. That was a separate, the transportation study was separate, but in conjunction with the prior land use planning services. And then finally, just to highlight, we also performed an ALTA or NSPS land title survey that stands for the American Land Title Association and the National Society of Professional Surveyors to make sure that we knew where the proper property boundaries were, you know, all the legal descriptions, et cetera. So based on our consultant's final reports, as included as reference materials to this agenda item and board order, staff does not find any objections to the purchase of this property for the development of the Lane Stabilization Center and Timber Springs Inpatient Facility. So staff recommends that the board authorize the county administrator to complete the purchase of the property in Springfield for the development of these facilities. And I am prepared to address any questions the board may have regarding this item.
All right, great. Thank you very much, Mr. Ward. Ms. Verio, do you have anything to add?
Thank you, Chair, Commissioners. At the moment, I am available for questions, but I think Mr. Ward summed it up nicely.
Okay, great. Thank you. Any questions or comments from the board? Yes, Commissioner Buck.
I'll get us started. It's been a lot of work to get to this point, and I'm very excited that we're at this point where we can eventually make a land purchase and move forward to real development. It is one of the biggest things that I hear out in the public of our need for mental health services in the community. And people, meantime, don't have places to go and don't have services that can help them, and they're suffering. We have a chance today to actually make a meaningful impact for not only the Lane County area, but this is really a regional facility. And it's also exciting to see the city of Springfield becoming one of the largest healthcare hubs south of the Portland area. There is so much interest in what's happening at this location, and I really, really appreciate PeaceHealth coming and letting us know what the other property in front of the hospital is really slated to be, because that has been an outstanding question from the public is, you know, why aren't they moving the facility in that property? Why are we looking elsewhere? And I'm not usually privy to the information on how hospitals plan for the future. I also didn't know that the hospital was at full capacity currently, and without this pre-planning, we will have people waiting even longer in lines for healthcare, and that's unacceptable. So for me, this is a win-win-win. However, we know that there is some opposition to the site, and we can't deny that. The best I think, move forward is to ensure that we are really good partners with the city of Springfield moving forward, because this is just one step. There's multiple other steps to development. And some people feel like they weren't engaged in the city of Springfield at the level that they wanted to be engaged. And so it's important for us to ensure that that level of engagement is met. So as we move forward, hopefully with approval today, I would just want to make it contingent on the fact that we are working in good partnership with the folks at the city of Springfield. So they are well informed of how the facility actually works and can meet expectations and know specifically how it's going to operate. I think there is general confusion in the community between what houseless shelter is, what a navigation center is, versus what a stabilization center is. And they're all in the continuum of care for services for people, but they do very different things, and they operate in very different ways. And so we need to do a lot of good community outreach and education so people know exactly what this facility is for and how it differentiates itself from some of these other sites. I think that will be important as we move forward. But as a whole, I am very supportive.
Thank you, Commissioner Buck. Commissioner Trigger, please.
Thank you, Chair. Thank you, Commissioner Buck. You covered, I'm scrolling through here because this is a big packet on this item because it's a real estate transaction because of the environmental. I'll give up on finding the page I was looking for. Thank you for the presentation. Thank you to everyone on staff and our partners in the community who've been working on this. As former Sheriff Cliff Harold attested this morning, this project has been 6 years in the making. And thank you to our state and federal partners for the funding support for this initiative wherever it might be located. I am fully in support not only of the project, as I have been from the beginning, but of this location for all the reasons that were mentioned in public comment this morning, that we have talked about in numerous work sessions, in memos staff has prepared, and what Commissioner Buck just outlined. This is a long-term plan, and location will always be a challenge. We already know location has been a challenge in terms of finding one. Staff has looked to a greater or lesser extent at no less than, I think it's 36 properties over the years in service to finding the proper location, an adequate location, the right fit for this, and was mentioned earlier again by former Sheriff Harold, now with Peace Health. We could not even have envisioned a location and a partnership and an integration of services that we have an opportunity to realize back when we started on this project. I think it's important that we separate out the issues, and Commissioner Buck got at a lot of these things in terms of opposition or concern. Immediate neighbor concerns are a separate bucket of issues, and I have every faith that we can address those and work through those. The traffic concerns are a separate issue, the relationships with our partners at the City of Springfield. But I think we are here to solve problems, and we know there is an enormous problem in our community of unmet need around behavioral health care services and as part of the overall public safety system. And I'm confident that we can work to address these problems, but they're not problems in a vacuum. If we can secure this property and begin the next phase of this, then we can address those concerns, those problems. If we keep everything in the theoretical, we will live in this theoretical space of what if we build and what if we put it there and who's got concerns and are those concerns real forever. It's endless. We have to make a decision. We owe it to the community of Lane County writ large. The lack of care is unacceptable and it's unnecessary, and we have a very real opportunity to take a step on what I consider a true legacy initiative for this county. in purchasing this property and moving forward with this vision and this partnership. I think it is so important in particular to talk about how we engage with neighbors, about how different, as Commissioner Buck said, how different this is from other services we provide. 1 in 5 adults in Oregon at some time will struggle with a mental health or a behavioral health care issue. The Navigation Center is for a very specific population, many of whom perhaps would never have landed at the Navigation Center if we had had a stabilization center in this community way back once upon a time. The immediate neighbors of this proposed site, I guarantee you, one of them or a family member or a coworker of theirs or a neighbor of theirs will benefit from this facility at some point, if not at multiple points. This is for everyone because everyone will benefit from it. It's so critically important. And it really is part of our public safety system. It's a critical missing piece, and I know that is a priority everyone on this board has talked about and shares a deep concern for the strains on the system, the inadequacy of what we provide folks who intersect with the criminal justice system, but public safety is much more broad than the criminal justice system. This facility is a critical part of a holistic public safety system. We need it. We have an incredible opportunity. We have a willing partner. We have, again, thanks to our state and federal partners, the financial resources. We are perfectly positioned, and I cannot see a real reason and a real problem that isn't solvable that we should not move forward today. Thank you.
Thank you. Commissioner Farr.
Thank you, Chair. You know, a little bit on history. I don't have a very good record with PeaceHealth, other than our two of our 3 sons were born there. You know, back in the early 2000s, I was in the Eugene City Council when in a 7-to-1 vote, we rezoned the property in northeast Eugene from hospital in order to try and force PeaceHealth's hand downtown to where the old Eugene Hospital and Clinic used to be, which is now roughly where LCC's, the housing complex is. That's not very good. You know, I was 1 vote against it, but we forced PeaceHealth out of Eugene. And my heart was broken. We no longer have a hospital in Eugene because of that. We can discuss that at length. Moving forward rapidly to October 21st, 2019, we were, my wife, Debbie, used to work at the Bon Marché. She was a shoe salesperson down on the ground floor of the Bon Marché, which is where the Symantec building was. We were on a tour, and Commissioner, you were with me, and I remember the date and time exactly very, very well for a number of reasons. And I thought, it's about time we move forward on this facility. This was in 2019. And I thought we'd found a great spot. I thought we'd found a great location. But there were conditions that arose, predominantly raised by the city of Eugene and also by the neighbors that didn't work out. So we continue to march. Time drags on, and in the meantime, we have people who are suffering from not just sitting in enclosed rooms, waiting for help in the emergency room, but suffering from greater treatable symptoms than that. And in the meantime, we've been dragging our heels. A long time has elapsed. I like to say things that I made up, but I'm better off when I say things that other people said. This isn't just a facility, it's a lifeline. It means that when someone's in crisis, they'll have immediate access to stabilization, assessment, and treatment in a safe, therapeutic environment. Beyond that, the location of the campus is also ideal. It offers excellent access for law enforcement and mobile crisis teams, ensuring timely and coordinated responses to behavioral health and emergencies. Centrally located within the county, it provides equitable access for residents across urban and rural areas alike. My friend John Tompkins, thank you for the words. I wrote them down. I have them here in front of me. There's a lot more to be said about it. This is the right place. This is a good facility, and working with particularly the city of Springfield, because this is in Springfield, and things have moved a little bit fast perhaps in some areas, and we need to make certain that our partners in Springfield are not just hearing about it, They're a part of the decision-making, a part of every step along the way. This is the right facility. I am ready to move forward with this. Thank you for the testimony today. Alicia Beamer, thank you for being here today. Joan Tompkins, again, thank you. And to those who have left already, thank you very much for being here. Also like to thank, let's see, Grady. Thanks for being here this morning, talking about facilities. Let's go forward. Thank you.
Vice Chair.
Yes. Thank you for everybody for being here. Thank you for the 1,500-page packet, Mr. Ward. You know, I am 100% on board with the stabilization center, and I don't want the excitement we have for this to be clouded by what I believe to be a misunderstanding of what this center is going to be. You know, when we were lucky enough to have a tour of Riverbend and explain what the new building's going to be, and realizing that within 15 years you guys have already outgrown 1 million square feet is a very impressive number alone. And watching the wings of the emergency room that will be opened up with this new facility, and you know, there's a huge part of it that just knowing you're sitting there talking with former Sheriff Harold that's promising you this will be a clean place. This will be a place that we will be proud of. It really does help put some of that at ease. So, you know, people get put into positions for reasons, and I believe that happened right there. Commissioner Buck made some great points about our working relationship with Springfield. I will say I handled some very heated phone calls from our partners in Springfield. And I think we can do better. I think we can be better partners with them, working with them and letting them know what's coming down the pipeline and showing up to the offices, meeting with them, visiting with them. Nobody likes to hear news from Salem that you were not aware was happening, and I think that's what happened there. So I do appreciate, Mr. Adams, you're here in the crowd, you being nimble and getting these things done, because it's what needs to happen to make some of these projects happen. I do have a question, and it might involve Ms. Davies or Ms. Vario, you might have it. Is that piece of property in the FEMA Pickham that we're purchasing?
Yes.
Going to purchase? It is.
Yes, that piece of property, it would be subject to the FEMA Pickham's issue.
Right. Okay. So if you looked at it from a business standpoint, we are taking a piece of property that might not be able to be developed. And with our super siting, we are helping alleviate some of that hassle, turning that into tax revenue. I would assume that's part of, I mean, would be part of the super siting part of it, right? Why we had it super sited?
I'm going to let Ann answer that one.
Rob might be able to weigh in.
Sorry, Ann, we tried to keep you.
No, I wanted to stay in the audience, but I'm good. Ann Davies, Assistant County Counsel. So the super siting got us out of rezoning and a conditional use permit, basically. The Pickhams are going to be what they are. So if the Pickhams they've been delayed a little bit, and they're probably going to get delayed further. So, but there's still floodplain regulations apart from that, existing Springfield floodplain regulations that we'll have to comply with. The super siting didn't get us out of that.
Oh, okay, gotcha.
And this, the Pickham, this for the crowd is the pre-implementation code measures.
I wrote that down too.
Yeah, thank you.
Thank you, Chair.
Thanks, Chair. Okay, so all that to say, yes, we're in support. This needs to happen. This is going to, I have confidence that we will have a great partnership here, and we're excited for it.
Thank you all for your comments, and I appreciate Peace South, Alicia, Grady, and Joan. Thank you for the tour yesterday. We met yesterday. I find myself in a very difficult position, and thankfully, Alicia reminded me I represent both Peace Health, the complex, the vision, and also the vision of the campus industrial zone, and those neighbors that have still some lingering questions. We met yesterday, and I want to ask the board, and I am 100% behind this, and as I've said many times before from this dais, it's been 3 years since my son committed suicide as a victim of the Lane County mental health system. He had nowhere to go. We worked through that very painfully as a family for 2 years prior to that happening, so I understand greatly and deeply how this facility will help save lives. And what I don't want to do as a county commissioner is look families of Lane County in the eye for the next couple of years while we delay and kick this down the road and have other people and other family members suffer what my family did. So that's not what I want to do. So when I ask what I'm about to ask, I want to know that going forward, my intention is for this board to be 5-0 united in moving this project forward. And also, as Commissioner Buck so eloquently put, and thank you for that, to ensure really good partners and also to make sure that some of those partners who don't feel they were properly engaged have one more chance to be engaged, and then we can move on. So my suggestion in yesterday's meeting was, could we table this discussion, this decision, until August 26th meeting? And to me, that's the drop deadline. And then between that, could we organize a meeting between those folks who still have some engagement needs and some questions to have a closed-door meeting where some honest conversation can happen to address some of the issues that I've been fielding in the last couple of weeks, and specifically the infrastructure memorandum of understandings, how any traffic additions to this project could affect the City of Springfield's infrastructure requirements with ODOT at the Gateway Beltline interchange. The security plan and connections relationship between the connections folks and the P-South folks. I'm super impressed with former Sheriff Harold and the security that they've done over at P-South, in which they've showed us so great yesterday. And I'm confident that that is going to be a facility run like a tight ship. But we also need to bring connections on board with that vision as well, so that there's a cohesive security plan there. And third, there's some lingering questions, as Vice Chair alluded to, of the supersiding explanation that I think maybe perhaps our Policy Director, Steve Adams, could add some insight to that. It may not make folks feel better, but at least that discussion can happen, and then folks can do whatever they want to do after that. The Development Information Meeting, the DIM, as we've been calling it in the packet, still has yet to happen, which could answer some of those pre-implementation code measures and flood and that kind of thing. It still may be too early, but I'm asking just for a few more weeks, just so that we can properly engage the folks that right now are still feeling a little bit hurt by the sledgehammer they felt was over the top of their heads, and so that we can have a chance to address that. And then fifth, I think just it would be really great if we could have our electeds, our boards, tour the site. I think that might be valuable for us to put some hands and some feet and walk the Filbert Orchard and just really see that vision for ourselves and have some on-site visit to that. I think that would be really valuable as a statement not only to the community, but also, you know, engage that with the City of Springfield City Councilors and the mayor. We could all meet there and do that. I think that would be worthwhile. So I'm humbly asking the board to consider tabling this motion for the 26th of August meeting. And then and there, I'm ready to vote 5-0 on this, regardless of where the opposition lands, because the opposition, I think, would have their questions answered, and then the decision they make would be on them. Do I have any discussion to that idea? Commissioner Farr.
Thank you. You know, I see real value in delaying for a couple of reasons. One being demonstrating that the board has full attention and full diligence and knows all of the ins and outs of the specific conditions that surround this particular property. I like the idea of touring the facility ahead of time to demonstrate that. And recently we delayed a vote on the Navigation Center for 2 weeks, and that 2 weeks proved to be a very valuable 2 weeks in talking with the neighbors, talking with the board, and getting a little bit more information out. That being said, gosh, we've been doing this a long time. We've been working on this for a long time, and I am eager. I'm faunching at the bit to move forward. I was in 2019, and it is, 6 years later. So, you know, I'll listen to what other people have to say about that. I'll think about it, but I'm ready to move today.
Commissioner Trigger.
Thank you. A couple of clarifying questions, because I'm also eager to move forward today, and none of the things that you mention am I opposed to having happen, but not necessarily, I don't think they're incompatible with taking action today and still doing those. but you said something about wanting to have a closed-door meeting, so I would want some input from county council or some clarification on what the topic of that would be, because I'm not sure there are things that can be, that qualify for such a meeting. So I want a little more clarification from the chair on that, and then maybe a response from any one of the numbers of attorneys in the room. Similarly to the infrastructure MOU piece, well, and the super setting, really there's some legal and policy questions that I don't know that we can't still address them, and in fact, they might be more properly and effectively addressed in the course of the initiative moving forward with a purchase agreement as opposed to prior to. Does that make sense? And so also, so clarification from the chair about what which part of these is a closed door meeting, and then any response from council about that, or from our policy director about those policy pieces around the MOU and the super siting.
Thank you. I appreciate the offer to respond. In our meeting yesterday, some of the Peace Health officials were saying that the vision for the properties that they have around the Peace Health complex is market concerns and competitive nature. And so some of that disclosure is probably not suited for public information, but could be in a meeting that had an agreement, and perhaps even in non-disclosure agreements there. They could say, you know, some of the questions I've been fielding from the opposition is, well, this piece of property has a box on it, but what's really that for? They don't really understand fully what the extended 75-acre vision of property that Peace Health owns around it, what's it for? And I think Grady articulated that very well in his public comment was, you know, we have a 100-year vision that we're 20 years into it, and all of a sudden, you know, the hospital is full. So that 200-year vision, as he mentioned, becomes even more important in addressing the concerns of the opposition as to why some of the property is still yet undesignated. So I think that allows an opportunity to candidly discuss that without those discussions being in the public circuit. Commissioner Buck.
This is a question, I think, for you two specifically, is I do believe that there are contract deadlines, and I want to know if a delay in the vote would be impacted due to the contract deadlines.
So we've had 2 extensions for our due diligence to accommodate additional time for these additional studies, the most recent studies. Our end of due diligence is actually on the 2nd, but because it falls on this weekend, we're due to deposit on escrow money on Monday the 4th. So per our agreement with the seller, August 4th is the final day of due diligence. That being said, I think because of the nature of this project and because I am personally aware of the seller's support of this project, I believe that I could ask for an additional extension through the end of the month to allow some additional time, not only to meet with Springfield on August 21st as scheduled, but to have some additional time for the board and others to be a little more engaged in the next few weeks.
I think that I'll add that I am prepared to vote today. I have been, because I knew it would be on the schedule. I do think many of the things that you mentioned need to be done. I don't have any issue with that. My issue, I think, mainly is we can still approve the project today and do those things. I'm not sure what the delay will change in that chronological order of things. Because I think we need to do any and all of that. And I do believe that we have had several meetings with the neighbors, but I am fine with continuing those conversations because I think we need that regardless as we continue forward with the development of the property. Of course, I would love to be able to see if I vote on the board for this really great project. And I can see why you're asking what you're asking. My concern is I want to move this forward, and we can still do all those things simultaneously.
You ready? Go ahead.
Yeah, I've got a question. What is the meeting on August 21st with Springfield about?
That's the development meeting with City of Springfield to determine what is needed to move forward with annexation.
Oh, that's the development. Got it. Okay, so is it, I mean, I understand where everybody here is coming from. Just like Commissioner Farr mentioned, it was a couple weeks on the Navigation Center helped put in place a lot of trust that had been eroded by making decisions and then meeting with people. I support this project. I support waiting till the 26th. I understand everybody's angst and excitement. I think that will give us a couple more weeks to mend some of these fences. I would actually, Mr. Rickoff, you've been handling some of the PR work on this project. What would your input be on this? Do you think in a couple more weeks we could mend some more fences with Springfield, or are we there yet?
Chair Level,
I don't mean
Vice
to put you
Chair
on the
Seneca, that's a great question. I think first and foremost, I would want to check with all of the partners here in the room to make sure we're not missing a critical element that could indeed impact the overall package. And at this point, I don't have great certainty that we know that we've worked this out in terms of what this delay would be. In addition to that, I think there is still a great deal of work to do to rebuild trust, create the greater community understanding, have this be the best neighbor, the best partners possible. And, you know, with another meeting will be a start of that. I don't know, this isn't going to be complete until we're up and running and we're solving issues together and being responsive as good neighbors and great service. You know, with that said, I guess I would like a moment to make sure that we're not missing anything that could be impacted by the delay.
I invited Ann Davies back to the table to help address any questions about the development issues meeting and what that timeline is.
Yeah, so I'm happy to answer more focused questions too, but the August 21st meeting is an opportunity for, it's mainly going to be the county folks, because the way we've got the purchase structured is the county's going to buy the property and then sell the other part to Peace Health. So it's mostly the county that's going to be like carrying the weight for this DIM pre-annexation meeting. But we are anticipating by the end of that meeting to have a much better idea of which issues Springfield is maybe a little bit more caught up on. So we know transportation's an issue. They have the study now. The study that was in your 1,500-page packet was dated, I think, the 25th. So that came out very recently, and so they've just put their hands on it and haven't even, I mean, that was Friday. They haven't been able to really digest it. So by the 21st, we'll have a lot better idea of what they're thinking about the transportation issue and every other issue. So we'll have more information, and we're hoping that things are going to be moving quickly.
Commissioner Trigger.
Thank you. I have a thought, Chair, for your consideration. The item before us and the motion are very specific to authorizing the purchase of real property. And I wonder if you would consider, because I'm in support of all the things you outlined, I won't speak to the how of it or the order of operations, because I'll leave that to legal and to our partners, because, for example, the item you mentioned about a better understanding of the 100-year plan, that's really between Peace Health and the City of Springfield. It's not a county issue. There's a lot of moving parts and pieces. So what I would offer or request is that we move forward with the order before us today, which is very specific to authorizing completing purchase of real property. And that gives you the remainder of the day and over the lunchtime to think about an assignment for the afternoon that has routine report backs, that has reports from staff and updates on each of these items. so that we start baking into the project as we move it forward, ensuring these specific things you raised are addressed on a regular and timely basis. And that also gives staff time to coordinate with entities that are outside of the county, but that they're working really closely with because of the constellation of partners on this, to bring back a plan for assuring you that those conversations are happening, even though it's not county work. We can't mandate that Peace Health meet with the city of Springfield, but I bet they would, or they are. So it gives staff time to bring us back sort of a plan that's built around these 5 items that you've raised, and possibly, and then some. So we sort of get the best of all worlds, and I would be fully supportive of such an assignment.
Just one comment with regard to that is, rather than waiting till the afternoon or whatever, your motion could include a direction for staff to come back after that 21st meeting with information. And, so on the 26th, even if you move forward with the authorization today, you could also direct staff to come back on the 26th, 28th, whatever that day is, with a report on what happened at the DIM meeting.
Yes, Commissioner Farr.
Well, I'm weighing all of this. And thank you for your input regarding what's happening on the 21st. My big issue, not issue, but my big concern is that the city of Springfield feels a little bit left out or a little bit dragged along behind. And I'm not certain if passing the motion today, not passing the motion today, excuse me, if delaying the motion would help that in any way. I think, so I strongly support meeting with the city of Springfield, Peace Health meeting with the city of Springfield, and the elected officials and staff to make certain that they understand all of the issues that are involved. I think they do understand it. I think the issue is what I've heard personally from members, the elected members of from Springfield, is that they felt that a surprise had been pulled on them. And I don't know if delaying the vote from today to what's the date that you're suggesting? The 26th of August. I don't know if that would help alleviate them feeling surprised. I don't know. I'm weighing this. I understand there's a huge delicacy involved with the city of Springfield on this. And if delaying the vote in any way is going to help them to feel more included in the process, then I'm in favor of it. If it's not going to help that, if there's no net change in the way they feel about it, then I don't see a value in delaying the vote. So I'll hear from others. I'm still thinking about this.
Vice Chair.
Yeah, I think, and this will be, my last go with this. I support waiting, and part of that is, as Ms. Davies brought up, there's been new information added to the packet, and it was being added to the packet right up until the drop dead, which is what we asked. We wanted all the information we could get there. I mean, that is what the direction was. And now, thinking that Springfield just got a lot of this information just as it's coming to, I think it sets us up to be longer, better partners with Springfield in this topic. I mean, traffic was a huge, huge part of it. And the traffic right now versus, there's a giant building that's empty out there. They're concerned if that building gets bought and somebody starts using it full time, what's traffic gonna do? And that's for our amazing staff to work through with Springfield. But I would like to see that happen before I approve it. That being said, I'm in full support.
Thank you, Vice Chair. Commissioner Buck.
Figure that out.
Thank you. I would support passing it today and having an agenda item or reports back on the issues that you've raised. I think that we'll have likely regular reports on the progress of the project anyway, but I think those specific needs, we can surely have those reports back. I too question whether 1 month will, people will change their minds that quickly. I think it's going to take some ongoing effort for education on what the project is, what the stabilization center is, and as I mentioned before, versus some of the other projects. And it also looks like we have Peace Health coming to the table to kind of, I would like to know if there are impacts on the Peace Health partnership side with a delay of this kind.
Chair Lovell, Commissioner Buck, I did ask Alicia to come up and join us. There is a submission that they need to wait on. They cannot submit until after the purchase is made. So I wanted Alicia to have the chance to explain that submission.
Ms. Beamer, go ahead.
Yes, thank you.
Make sure you're close to the mic too so we can hear
Thank you. Can you hear me?
Yeah.
Thank you, Chair Lavelle and Vice Chair Seneca and Commissioners. Yes, so we, as far as the process goes and our next steps for the property are, once the county has finalized their purchase, then on that day, Peace Health intends to submit the letter of intent for the certificate of need for our inpatient psychiatric hospital. And we cannot do that until the county has the land, because of the MOU will then demonstrate that we are acting in good faith to secure the land on the Peace Health side, and that we will have that within 60 days. And then we'll be able to submit the certificate of need for that facility. And that process, as we learned through our inpatient rehab hospital and the development, that certificate of need process takes about a year to go through. And so we're really very anxious to get that certificate of need going so that we can get our services that our community needs so vitally up and running as quickly as possible. So we do appreciate Chair Lovell's request and suggestions coming to us to continue those important conversations with the neighbors, and we do want to continue to engage in those. And we feel that's very important. Thank you.
Yes, Commissioner Trigger.
Thank you, Chair. I'm ready to make a motion if you'd like, and then people can speak to the motion if need be. Chair, I move approval of Order 25-07-29-08, authorizing the county administrator to complete the purchase of real property in Springfield, Oregon, as presented.
I'll second.
It's been moved by Commissioner Trigger and seconded by Commissioner Buck on Order 25-07-29-08, authorizing the county administrator to complete the purchase of real property in Springfield, Oregon. Is there any discussion to the motion? Yes, Commissioner Farr.
Thank you. As I make my decision on how to vote on this, I'm worried, concerned whether in offering a placation to the city of Springfield, we're merely offering a platitude. It's like, it's going to happen anyway, so just sit back and wait. You know, so, and I'm not sure, I'm trying to put myself in that seat. What if somebody is doing this to me, saying, well, you know, it's going to happen anyway, just sit back and wait. Go ahead and read it. Doesn't matter what you think after you read it, we're still going to do it anyway. So I don't know if I'd feel good about that, quite frankly. So I think I am going to vote in favor of this motion today.
Any other discussion of the motion? Thank you for your consideration. I'm in a very conflicted spot. Commissioner Trigger had mentioned that in a previous meeting, that being in a spot like this is very difficult. I will, this is tough. It's tough because I really want the meeting. I want us to extend that olive branch to the city, who is going to feel like they're run over if we do this. I'm representing both the city, I'm representing both Peace Health and the people that have opposition, and I think, I believe that this would be a good gesture. Everybody knows we want this. The community needs it. We know it's 99.9% sure going to go on that spot. But I want people who oppose it and have problems with how it went to be okay with it. And I want them to have the opportunity to voice their concerns and to voice their disappointment and their embarrassment and whatever other feelings they have about it, so we can clear the room of that baggage and move forward, even if everyone's not on the same page. But at least everyone would have the opportunity to have vented appropriately, so they would at least be heard. I think that's what we've said. What's important to this board is that people need to be heard. And I think voting on this today just tells us we don't care about Springfield's municipal partners, our mayor and our city councilors, of being heard properly. And so I'm going to have to not support this motion going forward, and it angsts me dearly to say that because of the loss my family has and how important this thing is. But it's important to me to get this right when people in the community have felt like they've been stepped on. To that, I'll call for the vote. All those in favor signify with an aye.
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 All those opposed, nay. Thank you. The motion passes 4-1. Next on our agenda is item 5B, which is a report on the legislative update of the 2025 session. And with us is Steve Adams, our policy director, and Vanessa Cornwell, our intergovernmental relations officer. Welcome to the dais in the Harris Hall this morning. And I thank you for coming, and take it away. It's your presentation. Thanks, sir.
Chair Lovell and commissioners, thank you for the opportunity to appear this morning. Our task is to bring you up to speed on what has been a very action-packed, very consequential set of months in the intergovernmental affairs portfolio. So I'm just trying to go from where we are today and just remind you of where the board and where the staff and really where the state legislative leadership and the governor were just a few months ago. As we were coming into the fall, of course, you know that working up to the every other year long session is an arduous task that takes many, many months of preparation. So setting the stage for you coming into the January 2025 commencement of the 25 long session. Late last year, coming out of the short session, which focused in Measure 110 reform in large part, many pieces of work were kind of moving forward of great importance to the board. Public safety funding has certainly been a priority for the board, and we went and were successful in advocating for a plus up to the Community Corrections Act funds in 2024. And we certainly saw consistent state leadership from the governor and from legislative leadership on the priorities that have really been kind of top of mind for the administration, and in some measure shared by this board's priorities around housing production, homelessness services, the behavioral health system and the crisis that the state continues to cope with, and education being the third primary topic that is kind of beyond the purview of this board directly from a policy perspective. So we came into the 25 session really with the governor very focused on those three areas. And in fact, we saw the governor making specific recommendations for the governor's recommended budget in which most of the agencies, nearly all of the agencies that were not focused specifically on those priority topics were directed to submit 1% increase budgets in large measure. So really a very focused kind of piece. We had also ongoing fairly decent performance from state revenue forecasting, and so there was a lot of hope coming into the session that the economy would be sufficient to be able to sustain ongoing funding. Finally, this was the transportation session, and so Oregon typically takes up transportation packages on a routine basis. 2017 was the last time that we had a major package, and so we kind of came into 2025 with a real focus on that. And in fact, during the interim, the Joint Committee on Transportation had been doing listening sessions across the state, including one here in Lane County. And so we had much anticipation coming into session. So atop that, we had an election in November, and we had a presidential transition in January, and we've had a very active presidency in the few months since. We've had a rather large volume of executive orders coming from the White House. We've had a lot of discontinuities in previous policy positions around trade and international relations, and we've had ongoing work on the federal stage within Congress with new unified leadership of the House and Senate under Republican leadership. And so there was a lot of uncertainty coming into the legislative session as members came in with a certain set of priorities. They were really trying to kind of understand at the same time what was going to happen at the federal level and factor that in to the state level. So we came into session with a set of priorities. Specifically, behavioral health was at the top of our list in terms of specific direction that the board gave us. You'll recall that we were working hard to try to seek an early session reappropriation of previously appropriated dollars to support the $14.5 million stabilization center capital request. And so that was one of our premier efforts. And early in session, we worked very hard at that. And obviously there was not a pathway to making that happen. Some of that was just technical in the nature of the kinds of appropriations that we were working when one was a capital, the other was a general revenue, and then half the funds were no longer available for appropriation at that time. So we knew we then had to wait to end of session. We had a slate of policy bills that we were focusing on, most notably maybe the assessor, Mary Cluse Schaefer, was active on the statewide stage in looking at CAFA reform, and CAFA is county.
County Assessment Function Funding.
There we are. My colleague, Ms. Cornwall, to the rescue on the thing. So that was a top line priority for us as well. And then we had a number of budget-related bills, right? Because the county and the state are in the business of co-funding and partnering on the delivery of a wide range of services. And going into session, we thought we had a revenue picture that was going to be conducive. We wanted to continue to invest in the behavioral health deflection program that was stood up after last year's Measure 110 very successfully here, and Wayne County's received incredible kudos for that work. And then we were cautiously optimistic that the Community Corrections Act funding, which is critical to our parole and probation, our sheriff's office, and to many of our not-for-profit service providers in the community, would receive healthy funding. In fact, the governor's recommended budget came in at a very healthy level. So those are just some high-level dynamics, and I would be remiss if I didn't just note that we were coming into this session with a newly hired intergovernmental affairs manager as well. And so my colleague, Vanessa Cornwall, this was her first legislative session in the state of Oregon representing a county in a wide range of issues. And it has been an enormous pleasure. And I'm going to hand the presentation off to my dear colleague to walk you through some of the particulars of the bill. But you will see, I think, in her presentation what we saw daily in terms of her command, her quick study of all of the issues that we had to deal with. And without Ms. Cornwall's diligent work, we would not have had anywhere near the success that we had this session. So with that, I'm going to turn it over to Ms. Cornwall.
Good morning, Commissioners. For the record, Vanessa Cornwall, Intergov Relations, and I am here to provide a little bit of a deeper dive into the 2025 legislative session. There we go. It was my first legislative session, first long legislative session, and compared to the Lane County priorities and principles, I think we came out pretty well. I will not be able to touch on all of the bills that were addressed because a record number of bills were introduced at over 3,400, 640 of which have been sent to the governor for signature. So if there is a particular measure you'd like additional information on, please let me know. I will be happy to follow up with you afterwards to give you more detailed information on a particular bill. I also want to thank each of you for your participation in this session. At one point or another, each of you provided written, verbal, or in-person testimony for many of the priorities that we went out on. So again, thank you for all of your help in getting those priorities across the finish line. As far as some session highlights, we did get our full funding ask for the stabilization center, and that would not have been possible without your advocacy and without the advocacy of our delegation in Salem. They made it their highest funding priority ask for this session, and it was critical in working with leadership to make sure that it was added to the final end of session omnibus, or a Christmas tree bill, if you are so inclined. We also saw some local investments in that final omnibus for the city of Eugene in their Clear Lake Economic Development Initiative. Oak Ridge got some funding for the Oak Ridge Community Health and Medical Services Center, which will be located at the Willamette Activity Center. Cottage Grove received some funding for some accessibility upgrades to the Armory building, and then the city of Veneta received some much needed funding for their wastewater infrastructure upgrades. As far as some of the top line bills, first I will touch on HB or House Bill 2005, which was a major package aiming to improve access to mental health and substance abuse disorder treatment by establishing diversion opportunities and alternative treatment plans. Specifically, it modifies the statutory definitions for what it means to be dangerous to oneself, dangerous to others, or unable to provide for basic needs, which are the three criteria for civil commitment. It does create new options for pre-hearing diversion to intensive treatment. It requires community health programs to coordinate placements, recommend assisted outpatient treatment, and support voluntary care when possible. It also mandates new restoration and community restoration time limits. In conjunction with that, because of the expansions it made to residential treatment facilities, there was a specific appropriation targeted for residential treatment facilities in the amount of $65 million, $10 million of which will be dedicated to youth treatment facilities, which will be governed by Oregon Health Authority. We also saw the inception of the Oregon Public Safety Coordination Grant Program, or the One Grant to Rule Them All, which gives the Criminal Justice Commission the responsibility for reorganizing most individual public safety grant programs like impacts and now deflection. The Criminal Justice Commission will conduct rulemaking on how they're going to implement the deflection program, because that was previously held within the Oversight and Accountability Council and Oregon Health Authority, but they will be distributing the funds with a few changes. First, the funding floor has been increased to $300,000, which will revert back to the baseline of $150,000 after 2027. By then, they will probably have decided how they want to continue to implement funding for the program based off of what has been working for counties implementing the best practices. There will be 25% guaranteed available funds that will be allocated based on the formula used for the initial grant. The remaining 75% will be administered on a competitive basis, tied to the county's ability to meet those best practices. Lane County also received 2 new circuit court judge positions, thanks to the advocacy from Judge McAlpin. And the legislature did also grant an increase to salaries for circuit court judges in order to compete with neighboring state pay scales. We did also see a change for Behavioral Health Resource Networks, or BURNS, and the grant administration for that program. This transfers the responsibility of the grant allocation, award, all of that regulatory authority from the Oversight and Accountability Council to Oregon Health Authority specifically. The Oversight and Accountability Council will still act in an advisory capacity, but Oregon Health Authority will have final determinations for where the funding goes, who gets what, all of that good stuff. The legislature, under that same bill, which was SB 610, repealed the requirement for the authority to establish a behavioral health resource network telephone line, as it was not utilized. Some of the changes we saw to housing, shelter, and community services. Specifically, we saw the statewide shelter program enacted to permanent status, which sets up the regional coordinators to administer funding to shelter providers. The initial text of that bill included a $217.9 million fiscal to establish these programs, where the regional coordinator would distribute the funding to the providers based on the needs and past performance of a region. When it looked like the bill was not going to pass due to the high fiscal, the fiscal was taken off, so it wouldn't remove the framework of the bill, and instead the fiscal was added to the Oregon Housing and Community Services budget bill at a smaller allocation of $204 million, half of which will be one-time funding. The other half will be the new baseline within the OHCS budget for this program moving forward. A couple of the budget bills I'll include in this slide was the Oregon Health Authority. The top line budget included some funding for public health targeted for reproductive health services and school and community-based primary prevention. We also saw some changes to the Medicaid budget, and due to some of the federal uncertainty around how much the state was going to receive from the feds, also saw some changes in that. The reduction in funds to Healthier Oregon was instead shifted to cover the basic health plan, so additional individuals who need like sliding scale services don't necessarily qualify for OHP or Oregon Health Plan can still get some services covered under the basic. But over $500 million was withheld specifically for the Healthier Oregon program as a special purpose appropriation to account for expected federal reductions. Behavioral health designations targeted community mental health providers to provide deflection services. The Harm Reduction Clearinghouse Grant to Save Lives Oregon received $10 million, and some additional funding was set aside for aid and assist services and funding for grants that oversee behavioral health permanent supportive housing programs. Oregon Housing and Community Services did include some funding for the Housing Infrastructure Revolving Fund, but it did experience an 80% reduction from the governor's recommended budget for rent assistance and housing protections. It was expected to see some of those provisions get added to the end of session omnibus, but most did not. And for the Oregon Department of Human Services, they increased the budget for intellectual and developmental disability program by 5% due to rising caseloads and cost and expected declining federal Medicaid match. So they're trying to account for some of the differences we're not going to see in the federal funding coming down the pipeline. Next, we have some changes to property tax, land use, and special districts. First, we saw the Tyler v. Hennepin fix in House Bill 2089, which provides a process through the unclaimed property program of the Oregon State Treasury to claim surplus proceeds of property that has been foreclosed, deeded to a county, or sold to pay delinquent property taxes. Counties must now provide a variety of notices with info on tax deferral programs, legal aid, and foreclosure avoidance services. Translations must be available in Oregon's top 5 non-English languages, and notices must be sent to former owners, various state departments, and posted publicly. Counties must conduct due diligence to locate owners using various databases and public records and provide redemption expiration notices at least 1 year before the redemption ends. There are mandatory appraisals for residential properties over $250,000, and surplus proceeds are deposited into an interest-bearing account until the amount of the surplus is determined. And then once it's determined, that will be sent to the Oregon State Treasurer for deposit as unclaimed property. We did see the legislature move to establish a task force to address the issues with measures 5 and 50, with a report from the legislative revenue officer due at the end of this year. There were 4 separate measures, 5 and 50 bills, so seeing them truncated into one task force study bill means to me that the legislature is very serious about seeing the implications of these measures and how the legislature can go about fixing them. And then we were successful in getting some help to the Mapleton Water District and the Mapleton Sewer District, specifically by expanding the justifications for a domestic water supply district to exercise the powers of a sanitation district under an ORS established for Blue River after the Holiday Park fire. The original legislation granted authority to a water district to assume the authority of a sanitation district in the event of a public health emergency. And as you know, the Mapleton Sewer District, which is run by a public charity, the Mapleton Commercial Area Owners Association, is severely financially constrained. And being a public charity, they're unable to qualify for state or federal assistance via grants. So we worked with the Mapleton Water District, the MCAOA, and Representative Wright to expand the justification under the specific ORS so the districts can work through the process of becoming a single district. Our Vice Chair, Commissioner Senega, testified to that bill specifically, and we thank you for your work on that. Couple budget highlights, specifically the Criminal Justice Commission appropriates money for restorative justice, deflection, jail mood, which is the opioid use disorder treatment in local jails program, and impacts, which impacts was a last minute addition. The funding was not set aside for that in the initial text, but due to some advocacy with stakeholders, it was included in the final budget outline. Department of Corrections was probably the hardest one to get through due to the Office of Economic Analysis forecast, which was released in April. The projected adult in custody population was reduced quite drastically, and the anticipated growth projected in 2024 was no longer expected. So the community corrections budget was reduced by almost $33 million with a total allocation, as you can see there. This funding is based on the capitation rate for how much it costs counties to house adults in custody. As Mr. Adams mentioned earlier, we were expecting an increase based off of the time study funding that was outlined in 2017, which would have brought up the amount to handle those individuals to just over $18 a day, but that was not adopted. And we are waiting to see whether or not there will be some additional advocacy from stakeholders for a possible special purpose appropriation later in the session, because some counties have announced what they intend to do due to this funding decrease, and we're hoping that the legislature will kind of go back and review some of those decisions that they made. Other key bills that we saw going through the final days in session was a building code and mapping requirement change for wildfire hazard mitigation. Those building code standards and mapping requirements were eliminated. We saw the landowner immunity laws making the temporary changes that were done earlier permanent. We also saw a landfill emissions monitoring bill go through. Initially, that was designated for all landfills in the Willamette Valley, but due to some pushback for cost concerns and some issues with the perceived reliability of the technology, this will now only be applied to Coffin Butte. And then we did see one of the more contentious bills go through the legislative session. It was a Senate bill that guarantees unemployment benefits for striking workers. The initial text included 26 weeks of eligibility for striking workers to receive benefits, but that was reduced down to 10 weeks based off of some of the legislation enacted in Washington state. We also saw the task force study bill get enacted for a task force to study solid waste in the Willamette Valley. This will have a task force of 12. 4 will be appointed by House and Senate leadership. 8 will be appointed by the governor to study issues related to solid waste in the Willamette Valley, just to see. It's going to include people, stakeholders who work in that arena, who will be impacted, and then at least 2 seats will be held by environmental organizations.
Excuse me for a moment.
Yes, go
Chair
ahead,
Lovell,
please.
I just thought we should do a time check. I know that we've got a 60-minute item
We do.
coming up. That is time certain. I didn't know how you want to proceed, given the fact that this is critical information and will need to be delivered at some point.
Do you want to continue, or do you want to schedule another time? What's your
Well,
druthers?
Yes, I would defer to you. We can certainly shorten up the deflection meeting. We do have the DA joining us and others, so I do want to respect their time. So yeah, maybe we give this another handful of minutes to wrap up, and we just do it in 2 stages?
I don't have much left.
Oh,
super. Okay.
Yeah.
Sorry for the interruption.
So there were a few priorities that didn't pass listed here. We will see the CAFA funding fix come back in the short session, just because our representative Nathanson, who is chair of House Revenue, really made this one of her priorities for this session, and due to some stakeholder pushback and additional work that will be done by our county assessor, who did an amazing job. That advocacy continues, so we'll likely see that get pushed through the final short session. And then our Clean Lane Supersiting bill, which was brought in very late, did not make it across the finish line or out of House rules due to some time constraints. And then finally, the transportation package. As Steve mentioned earlier, this was a transportation year. We were expecting at least something to come through, and there were a variety of some things that were introduced, but ultimately did not make it through. It was very dramatic on the final day of session, a lot of pausing to see whether or not they were going to be able to get the votes to move it forward. Ultimately, it did not, and a special session has been scheduled for August 29th to address the funding issues that ODOT is experiencing with announced layoffs. So with that, any questions that you might have, happy to provide some additional information later due to the time constraints, but this was the quick download for a very large session.
Well, Ms. Cornwall, you did an awesome job. Thank you, and Mr. Adams, for such great representation for Lane County and getting the slog through 3,400 bills. I'm surprised that that would take probably a full day to go through a briefing on those, I would imagine.
Oh.
If not more, yes.
If not more, at least the 640 that went to signature, so.
Indeed. Well, thank you for the great fight up there. If there's a quick comment from the board, we can. If not, I'd like to recess to our Board of County Commissioners room for our deflection presentation, and then move the announcements from our county administrator to the afternoon session.
Just
Quickly,
note,
please,
note
yes.
for anybody watching the materials, you do list all the bills, not just the ones you went through, vying for most pages of a packet item today. But thank you for that. That tracker's been really helpful throughout session, and certainly in the resolution of session. I've been referring to it. Thank you.
Okay, one quick one from Commissioner Farr.
A lot of stuff, but very quickly, House Bill 2005 will continue to get a lot of attention. The implementation in September, you'll see LGAC will be taking that up extensively, and I'm going to invite you now to join us for that.
All right, good. And with that, we're going to recess the Board of County Commissioners room. We will meet at 11:06. Thank you. Recess. Board of County Commissioners back from recess. We have an item that is our deflection program update. We're excited to hear Clinton Riley, our deflection program manager. My apologies for being 6 minutes late, but I'm talking fast and it's all yours, sir. Go ahead.
All right, good morning. Well, I got some partners here with me, so I'll introduce everyone.
Please.
Here. So I'm Clint Riley, I'm the program manager for deflection. Chris Barroso, district attorney.
Greg Rickoff, and for purposes here, of course, I'm the director of the Community Justice and Rehabilitation Services Department that has this deflection.
So the three of us all be kind of going through the presentation here. So.
And we do have Paul Solomon online.
Paul's on. Paul, do you want to introduce yourself?
Yep. Good afternoon. I guess, well, good morning. Paul Solomon. I am a criminal justice consultant to the deflection program and also the chair of the Criminal Justice Commission.
Okay. All right.
Good to see you all.
Thanks, Paul. So just a quick little background. I'll just kind of zip through real quick where we're at. The program launched in October of 2024, and we awarded two big contracts, Ideal Option and Reveille. We have peer navigators that respond 24/7 to work with law enforcement at the point of deflection. And then we also have emergency shelter beds at Reveille for folks that go into deflections that need housing, we can put them into housing immediately at the point of deflection. Myself and DA Perosa, we worked with all 11 law enforcement agencies in Lane County as we designed and built our program. As you all know, Lane County is very unique. It's very diverse. It's huge, covers several thousand square miles, and each one of our communities is unique and different itself. So we worked with their leadership, and myself and Chris attended briefings, met with leadership, chiefs, sheriff, to design that for each agency specifically. Next slide, Greg. Who can be deflected? This is our criteria. Adults who live in Lane County. I get asked this question a lot of times too. What if someone's unhoused? Do they live in Lane County? If this is where you call home, this is where you're at, that's what we define as in Lane County. If someone's here out of state attending a sporting event and have an interaction with law enforcement, but they live in Michigan or Florida, those are the folks that don't go into deflection. But if somebody doesn't have an address, but this is where they call home, they're eligible for deflection here. And then we targeted low-level quality of life crime where it's suspected their behavior is from an unmet behavioral health need or a substance use disorder. And so as I go into our eligibility criteria, really these crimes that we have as eligible criteria point straight to substance use disorder in many cases. Next slide. So now we'll go through our eligibility charges. One point I'd like to highlight a lot on that, our eligibility criteria is very, very broad due to DA Perosa allowing us to build the program, and counties have this broad a criteria. Measure 110 brought us back into the conversation of recriminalizing controlled substances. So a lot of folks started right there, just drug possession. We knew it was bigger than that. So the crimes that we have are unlawful, obviously drug possession, but trespassing, disorderly conduct, low-level theft, low-level property damage is the criminal mischief. That's a good point too there with victim consent. When someone's a victim of a crime, theft or property damage, that victim has to consent to the person going into deflection.
Clint, you said not all counties have this, but I don't think, do other counties have this broad a collection of
Not that I'm
charges?
aware of at this point. We probably have well, Paul, you can chime in. You've seen the.
Yeah, I mean, I've reviewed all the applications, and Lane County is fairly unique in the number of offenses beyond possession of a controlled substance that they're allowing in the program.
So we really are the learning community, the learning county in terms of how expansive this can be. And we definitely need to give credit to the district attorney for being a full partner, thoughtful in the moment when individuals are being contacted. You've had a couple instances of, are people eligible if they're in a drug house when other arrests are being made? So I mean, we are the point of innovation here.
Yeah, well, there's a story with that one too. Some of these charges that we've added have come as the program launched. I'll continually work with Chris on, do we want to look at this charge as eligible for deflection? The one came from a search warrant that was served one night where there were several folks that were frequenting a place where drugs were used, and law enforcement wanted to know if they could deflect them. So I got a hold of Chris and we reviewed it and he said absolutely. And so that has now become one of our charges that you can deflect on, as well as use on like public transportation and interfering with a police officer. Those were all added after we launched in October.
Have a good time for a question?
Absolutely.
Just a quick question. I'm mindful of time. I know you have a lot to get through, but it sounds like there's also opportunity to be in the moment about that you as the program manager can assess and say, let me check with the DA. I think this could be allowable. It's not currently. So it's not just expansive, but it's really flexible.
Absolutely. Yeah.
Great.
And that call came at 8 o'clock at night. They called me when they were out on scene, and then I touched base with Chris and we added it. And absolutely.
Great, thank you.
Any more questions on this one? Okay, we'll go to the next slide. This one right here, just a quick review. Initial interview, what's it look like? I get asked this question a lot, like what's it look like out in the field when someone's gonna get deflected? Law enforcement has contact with someone. They meet eligibility criteria. They've committed one of those crimes. There's probable cause to arrest them and either cite and release them or take them to jail. They have a conversation about treatment and deflection, and the person agrees to have that conversation with the navigator. We bring a navigator out. They continue to have that conversation with the navigator. Usually law enforcement steps away. The navigator has this conversation about life change and treatment and going that path and what we can do for them if they come in the program. If the person agrees to go into deflection, law enforcement leaves and the navigator takes it from there. Law enforcement completes all their paperwork on the back end as if they arrested the person and took them to jail. Because the accountability piece for our program, if this person doesn't follow through with the continuing meetings with their navigator, engaging in treatment, doing all those pieces, say they just go away and they don't come back, then that case can be filed through the district attorney's office, and those charges that are held in abeyance can come back and be charged with them. The big piece for our program that I'm watching, and I'm learning a lot from the navigators that we hired too, the most important meeting is the one the next day. So they agree to go into deflection that night. Say they go to Reveille for housing. They get their basic needs met, food, shelter, clothing. The next day, they sit down with that navigator and they build that plan of what sort of treatment do they need, where are they at, what sort of resources do we need to put into that person. That's where and we call it a person-centered approach. That person has a voice in their treatment plan. We don't tell them where to go. We just open the doors for them to go to any facility in our community that they want to go to. And then we case manage them and we do all the referrals, and then our navigators are the ones that manage the person's case management plan and report that back to myself and the district attorney's office weekly at our staff meetings. Questions on that? Okay, next slide.
Can I just make a quick comment
Yes, sir.
about that process? You know, one of the things that's unique about Lane County is the housing, the peer navigators, and the warm handoffs. In some counties, people are being given a referral and said, here, show up tomorrow at this place, or go to the courthouse, and you know, many people can't go from point A to point B without directions and a ride. And, you know, so to be able to say, we're going to put you in housing tonight, and we're going to meet with you tomorrow and engage people is one of the reasons why we have more people that are still successful in this program with a really challenging population. So I think those are unique aspects to kind of what we're doing in Lane County.
Those are good points. One thing I learned when I worked in the jail, when someone was released and connected to services, they usually did pretty good. As soon as they became disconnected, typically things happened that led back to low-level quality of life crime that would lead them back to jail. So keeping someone connected to resources is the key to success. And so we really try to build that into this program too.
Yeah, and your navigators are tenacious
Yeah.
in that connection. And
They are.
I mean,
Yeah. We couldn't do the work we do without Reveille and Ideal Option and the navigation team. They are the meat and potatoes of what's going on and the success that we're having. It's the work that they're doing and the housing that we got. The two contracts are key. Also, I should also point out, the treatment community has been very supportive, and over 100 community resources have been used with our program so far. And so they've been very supportive. It's been for everyone in helping the program. And law enforcement. All of our law enforcement leadership and officers have been very supportive of the program. On this one, I think I'll turn this one over to Greg and Paul to kind of talk about ongoing funding and kind of the new process that we're coming up on.
When you were hearing a little bit about that in Vanessa's report just a few minutes ago, there really is a new funding model. So a couple things. One, the funding is flat from its inception to this new biennium. So no cost of living or adjustments in those dollars. And of course that tends to put up warning signals for me as the administrator saying, you know, is this going to be a place where a state program is going to, by increments, get offloaded onto localities? And I'm staying optimistic about that, but I would have loved to have seen some increase in funding there. We will be paying attention to that over time. This new funding model really is designed, it's a pay-for-success model. It really is trying to lead in investments where the work is doing well. Every county was allowed to come up with its own design, although the CJC has, the Criminal Justice Commission has done a review and has pushed programs as it's gone. But this is really to promote deflection and not just another diversion or another program that's already embedded in the system. It's meant to be an add-on. My biggest fear is this formula at some point turning into a reimbursement model, that they need to see success before the funding comes through. We would not be able to operate those two major contracts with Ideal Option or Reveille if we have to pay in the front end and wait for a state reimbursement. So the devil's going to be in the details of how this gets rolled out. So we are very much interested in watching the Criminal Justice Commission move forward. Having Paul there is a godsend, and of course, the newest member, I think, of the CJC is the district attorney. And thank you, Chris Perosa, for saying yes. And although you had a lifelong seat on the board, you just
legally termed off.
Legally turned off.
I just had to leave.
This is a place where we are paying careful attention, because I honestly believe the CJC is where innovation at the state level occurs, and how this body proceeds. It's very optimistic in terms of the direction they're heading in, but it's also the state flexing a new model for how does this get funded. Paul, what did I miss?
I think you kind of covered the highlights. I'll kind of walk us through the detail around how it's going to be rolled out this biennium. So there was a Criminal Justice Commission modernization bill that did a whole lot of things in House Bill 3069, but it also restructured the way funding will be allocated for the deflection program. So for the first quarter payment, which is 25% that ultimately would pay for 6 months of funding, will be allocated on a formula basis using the same formula that was used for the first tranche of funding that was allocated, that is based on the Oregon Health Authority's model that looks at overdose deaths. Help me, Clint, what are the other criteria for the OHA model?
Emergency room, over OEs in general, as well as overdose deaths.
I think addiction rate.
Uninhabited population.
We tended to fare better. I mean, in a sense, that means we have a more difficult population to work with, but we, as a percentage of the state, we are getting a higher allocation than we would if it was on a straight population basis, like the grant and aid formula, or the number of people on felony supervision. So that'll provide funding that will be allocated September 1st. All of the counties have enough money to carry over to get them through the end of August. And then by the first of the year, the CJC will be rolling out a new process that is determined based on the number of people that you're projecting to serve and adherence to the best practices. So one of the things that I think sets Lane County up well is when you look at the best practice report that was issued by the Criminal Justice Commission, we hit all of the marks. Warm handoffs. We are working with peer navigators. We're providing housing. We have law enforcement buy-in. We have broad eligibility criteria. So there is a way that we could wind up seeing more money, because it's going to be determined based on the number of people that you think you're going to serve. And we're starting to see that when you look at the counties around the state, that Lane County is serving a good number of folks for a county its size. So I think we're well positioned to be able to expand the model over time based on the new criteria that's being rolled out.
Go to the next slide.
Yeah. Any questions for Paul, funding wise, moving forward? I think the next slide.
And Rob, chime in. You know, I know you were kind of had a front row seat to 3069 as well.
A little bit, but no, you guys are doing a great job.
I think next slide, I think we're gonna jump into our dashboard.
It's not moving forward. I try not to break things.
Likewise, and I failed miserably.
So we're moving to the live dashboard and setting it up so Clint can navigate us through the details of it.
And before we get there, what I can do too is we go through this, and I know many of you know already, but just a quick recap. We launched this probably a month and a half ago, and it's updated. It's updated daily, but as quickly as the DA's office can put information into the program. Is it up and going?
You gotta click on that.
You gotta click. I think if you click on it, I think it'll take us right to it. So as the DA's office inputs folks into the program, it is updated on the computer. So it's like not necessarily real time, but pretty live. And then what we really wanted to do with this was to be able to refer the community to a space where they could see exactly what's going on with the program, but also to be able to come to presentations like this and have real data to share with everyone. So I'll just kind of walk this through. I think at this point, if you have any questions at all, we can go deep in the weeds on this too. So if you got questions, just let me know and we'll stop at any point. So far, since October 18th, 210 people entered into deflection. We currently have 68 folks that are in deflection, and 16 of those have successfully completed the program. And so when you add those two numbers together, 68 and 16, those are the people, we're approaching close to 50% of the folks that have come into our program are either still in the program or completed the program successfully. And this population of folks that we're dealing with, that's a pretty high percentage. When Chris and I were talking about building the program, I would expect that to be around maybe 25%, 20%. To have 50% of the folks either done with the program and completed or still engaged says a lot about keeping people connected to resources and the programs and the work that our navigators are doing with the treatment community. 128 have been removed from the program. The key pieces of this one too, average days in the program for someone removed, 63 days. So we don't just remove someone the first time they don't do what they're supposed to do. It's continued attempts of trying to get them to engage. Most folks meet the navigator within 24 hours, develop a plan, and within a couple weeks, we never see them again. They don't come back, they don't engage. Our navigators continually try to reach out to them. We unless someone's causing safety problems in the community or a lot of chaos, we will give someone at least 30 days before we will refer them back to the DA's office for charges to be filed. Multiple bites at the apple to get this person to come back in. Many of our successful folks, those first 4 weeks were rocky, and they made it all the way because we didn't give up on them. I should say our navigators didn't give up on them. But also, too, we didn't give up on them by saying, let's file charges back on them. And then if you look at 63, we give people a little bit more than 30 days, I think, because that's 63. Average days in the program for someone that completed 131. You have to be in the program at least 90 days before we'll consider you for successful completion, which means your charges held in abeyance go away. You got to be at least 90 days engaged. And when we're looking for what's compliance look like to complete a successful completion, you developed a plan, you're meeting with your navigator, you're going to a provider in our community, As soon as that happens, you automatically start to see somebody have days of sobriety. You start to see them get clearer, and they start talking about employment, housing, family. It happens every single time. And I'm not saying that when someone's not on drugs that their criminality will typically decrease. Most times it goes away because we're talking low-level theft, trespass, disorderly. Those are all survival crimes that go along with substance use disorder. And so that's what compliance looks like. If we see that for 90 days and someone's doing really well, at that point, I think it's time for us to disconnect the criminal justice system, and hopefully that person stays with that program, and that's their road to recovery and their journey from that point on. Were there some questions?
Commissioner Turner, please.
One thing I just wanted to point out, because the question I get a lot is what happens that makes someone be removed from the program, and if you scroll the page, you show that down at further down the page, what those reasons are. The biggest one being no contact. They basically drop themselves out. But the question, the other, you were doing the right. Keep going. It's below the map. There it is. But what impresses me so much too is the sheer number of people we've been able to engage in services who were referred into deflection without a criminal, without a crime.
Yeah.
So this is also just proving to be a really important pathway to treatment and resources for people in the community before they commit a crime, and that is really important.
Chris and I were just talking about that before the meeting. That's if you look right here, non-drug related crime, referred with no crime, 30% of the 210 came with law enforcement calling us where the person hadn't committed a crime. But our law enforcement community knows, they know their communities. So someone might not be stealing at the time and they might not be in possession of drugs, but they know when someone's living that lifestyle. So when we designed the program, why wait for the crime to happen? If law enforcement knows this person, that's where they're at, offer them help. And law enforcement took off on that. And so 30% of our folks started out like that. And then you look at the other ones, non-drug related crimes, 33%, drugs only. If we would have had just drug possession only, 31% of our 210, that's who we would have served.
Which I think is a lot of what the other counties have, right? And that's why we have such different success rate.
Numbers. And really getting law enforcement a tool to help people. They've never had that before. And now they can pick up the phone, call a navigator, and get someone help.
When it's worth pausing there just for a moment, because to think about what this means is the law enforcement officer cared enough about the human being to make that referral, that they know, identify, connect with, and want help for that individual. So for a profession that tends to get a bum rap from time to time for not caring and just being about enforcing, to see the officers being hungry for this service and knowing, you've had meetings, staff meetings where officers have said, I know exactly who needs to be in this program, and it's initiated the contact.
That's kind of how we launched the program, to kind of get the wheels turning on, because law enforcement was the same way we all were. How's that going to work? What's that going to look like? And we all would say, do you know 5 people right now that are doing low-level crime that you know suffer from substance use? And they're all like, oh, I know 20. I know 25. This is the program for them. And then they kind of started thinking, okay, your retail theft partners are major department stores in town. There's law enforcement assigned to those cases. They're calling deflection because the people that are stealing from those places, they want help. They have substance use disorder. And so law enforcement has another tool, and they're working with the business community as these folks get deflected. And it's worked really well. One thing that we do also is, I know what's important to law enforcement. Accountability, holding people accountable, making sure they do what they say they're gonna do. We have an information loop that goes back on. Our navigators get the business card from the law enforcement person that deflects them. We email that officer to let them know the person showed up to their interview. We let them know the good, the bad, everything that's going on with that person, and they sign an ROI. And that ROI allows all that information to be shared.
Release of information.
Yeah, sorry, my acronym, sorry. So when we can't find someone or they're not engaged, guess who we call to see if maybe they'll see them? So the law enforcement community is working with us to try to make sure that we're connecting with people all the time. But how neat is that for an officer to maybe you see someone out in the street and be able to say, hey, I got an email on you. I saw you're going to treatment. I'm glad I deflected you. That's awesome. Keep up the good work. It's changing the interactions with law enforcement in the community and the folks that historically have gone to jail. Now they're kind of helping them in a different path. And so it's just been really, really fun and adventure.
And even the business.
Yes, sir, Paul?
I was just going to say, one more thing about law enforcement buy-in. I think one of the things that has made this program so successful in Lane County is the early work that Clinton DA Perosa did to engage. I mean, they were going to shift change, roll call meetings at all hours of the day, meeting with all of the law enforcement agencies in Lane County. And when you look around the state at other counties, it's not uncommon for them to have 1 or 2 law enforcement jurisdictions that are participating. We have all 9 law enforcement agencies participating in this program and referring people. There is strong buy-in, and I think that's one of the ways that this program is able to serve as many people because we have so many different agencies referring.
And we had Ideal Option was in place when we did those briefings. So I was able to take Josh there and Art Zamudio and our navigation team with me, so law enforcement could meet them as we were rolling the program out and ask questions about what is this really going to look like. And Paul's right, that was probably the most important piece we did, was meeting with the line level law enforcement officers that are going to be making the call. And thanks for bringing that up, Paul. I appreciate that.
Well, and it's accurate that only 9 out of the 11 law enforcement agencies. You want to talk about the other 2 that really?
Yeah, the 2 that haven't deflected, Coburg, which is a very small agency. They're lucky to have 1 person on duty at any given time. We haven't seen anyone from Coburg, but they're a participating department. They support what we're doing. And then the Oregon State Police, who I've learned a lot about the Oregon State Police since I started deflection. They are in 4 counties here in our county. So I think of Lane County as Lane County. A state trooper might be in their district. They might be in Lynn County, Lane County, Douglas County, Lincoln County, and that's all one district that they're in. So if they're gonna deflect someone, they gotta think, what county am I in? Douglas County doesn't have a deflection program. We have a pretty robust one. Lynn County has a program. Lincoln, and the state police, really, they're out on highways investigating crashes, and they do a lot of traffic enforcement. They're not necessarily responding to calls for service like Eugene Police or Springfield Police. So they do a little different type of work.
I do want to flag the business community buy-in. When it comes to not wanting to proceed with charges, it's been very impressive to watch the business community vote to help the individual, be committed to, I would rather have this individual deflected as opposed to pressing charges in the moment. So really, the buy-in with law enforcement, the buy-in with business community, and then the buy-in with the 100 different agencies that are helping to support the treatment elements, it's really been pretty remarkable.
Oh, and I've learned a lot from Chris during this too, of like a lot of those people that are victims of those low-level crime, they just want to see the person not do that again and get the help. And so I've heard him talk many times about when the victim consents to, they just want someone to stop what they're doing and get help. And people are like, yes, that's absolutely, we'll take that. Oh, also, Paul, help me, remind me on this one. I think there's money in the new bill coming that will be for reimbursing businesses if they allow someone to be deflected. There's money where they can get their money back for the damages to the business. Am I correct on that, Paul?
Yeah, so it's now an allowable use to pay for fines, restitution, et cetera.
Okay.
Does the person in the deflection program have obligation to that? Because if it goes to the justice system and there's fines assessed, they either have to go through programs or what have you. Is there?
We kept this one completely out of the criminal justice system. So when someone's charges are held in abeyance, they haven't entered the district attorney's office, so there's nothing like that. And so once they go into the district attorney's side of things and you get into the formal prosecution, that's where you get into that.
So victim restoration then is a state-funded program, not necessarily coming from the person perpetrating the offense.
That's a Chris question.
That's correct.
Yes.
And I think this is
buy-in from the state.
Yeah.
Yeah, it's good.
The this was added, I think, was thinking about like theft 3 charges where someone is stealing something from a Walmart or a Target and being able to say, here's $200 or $300 to make you whole. Would you be okay with this person participating in lieu of them being charged? So it just gives victims an option.
Yeah. And I think a lot of it too, when you're looking at what did someone steal? If they're stealing what looks to be like a meal or just basic stuff to survive, then that's pointing to substance use disorders probably causing that. So,
Mr. Stukeland, the last time you presented, you had 175 here total people served, just comparatively speaking.
it's increasing rapidly.
It is, yeah.
It
Good
is.
job.
So here's a breakdown of the police. Speaking of acronyms, we got them all by acronyms, but Eugene Police, our biggest police department in our community, has the most deflections. Then Springfield Police, Sheriff's Office, Cottage Grove, Florence, Junction City, Oak Ridge, U of O PD, and Parole and Probation have had a few of their folks that are law enforcement referrals, where these people needed help and we were able to help them out. The PMP is not responding to calls for service and arresting people and sending them to jail, but they have clients that are in need. So we're trying to help where we can help out there too. Trying to maintain the bandwidth of what we created. Chris and I were talking before. We have 68 participants. We kind of built the program off of 125 would be our capacity. We haven't gotten 125 active participants yet, so we don't know what that's going to look like when we get to that point with case management for our navigators and carrying a caseload of 25 highly complex individuals. And so we haven't been there yet, so we don't know what we don't know. But all of our different pathways in, we just got to be fluid as to, do we stop some of the pathways? Because really we built the program to be at the intersection of when someone's getting arrested, going to jail, to deflect them away. And so all of our pathways we have right now are working, but we've just got to be cognizant as the program grows to make sure we still have that resource for law enforcement to keep people out of the criminal justice system that when crime is occurring.
One of the innovative places here with parole and probation, in most counties don't look at individuals with a history of felony convictions as eligible for deflection. And it's something that we wanted to try because as we experience relapse amongst that client base, doing that intervention is really critical. What's wild about the three is they're all coming out of the Justice Involved Women's Program. So those are POs who are working exclusively with female clients and females who have had felony conviction histories, and it seems to be working. So I expect to see that number continue to be to grow in significance. But it's another place where we're leading the way.
Another eligibility criteria, which Chris and I did from the get-go, was if somebody has warrants for their arrest. Seldom does 80% of people that go to the Lane County Jail don't go to jail for a new probable cause crime. It's a warrants from prior crime where they didn't go to court, and the system is just flooded with people that have warrants all the time, not necessarily a brand new probable cause. So when we were designing the program, why would we exclude warrants? I'm thinking that's going to be most of our population's going to have a warrant or two, so we didn't exclude that. Some people around the state, if you have a warrant and you're outside of drug possession, you're not eligible for deflection. We couldn't get our heads around where's our people going to come from if we exclude that, because that's all I've seen in my career was people with warrants. And so and it's complicated. We have 2 big municipal courts in our community and a circuit court. So it's not uncommon for someone to get arrested for a Lane County Circuit Court warrant, Springfield Muni warrant, Eugene Muni warrant, and maybe a parole and probation violation. And so that officer has to book that person in the jail through 4 different courts as we cycle that through. So Chris's office and our navigators, we're working with Springfield Muni Court, Eugene Muni Court, and the Circuit Court. They're all our partners with this. As we manage people, we're helping them get through those other courts because Lane County is unique when it comes to the municipal court system that we have in our community. Most low-level quality of life crime gets cited through Eugene Muni Court or Springfield Muni Court, not the Circuit Court. And so as we built our program, we were kind of all these different moving parts, and it's hard for an officer. If someone's got a new crime going on right now with 6 warrants, deflect them on the new, you might have to take them to jail on the warrants. We've figured out ways to get people in. We'll have our navigators start working with someone when they're in jail. So when they get released from jail, they do a warm handoff to our navigator and they go to Reveille housing. So they agree to go into deflection, but they got to get their warrants cleared. And so we were working with the jail, all the different courts. It's complex, caused a whole other layer of work for our law enforcement community, but hopefully the end result is we're helping people get out of the criminal justice system. Let me zip down through here. This is an interactive, this right here, if you kind of hover on these, it'll show you how many people, it's not working, there it is. 7 people from Florence, and it shows the zip code. Make that a little bit bigger. I'm gonna show you zip codes and the number of people, 97402, 51 referrals have come out of that 97402. I think the 97402 and the 01 are where majority of our folks have come from, and then the 77 over in Springfield. This is where majority of the deflections are happening. But when you hover on that, it'll show you this is.
You don't see it on the barn, but if you click on it, it shows you here.
Yeah.
By month. Yeah, it shows it by month. Yeah, the toolbar is blocking it. I'm playing with it on my iPad. If you enlarge the map, when you click on one of the circles, it changes that bar graph below of number of accepted referrals each month to show you how many came from that zip code, that circle each month. Yeah, it's really cool.
So it enlarged the map for us. It's really cool.
Yeah.
It's a great dashboard.
Cool little tool. So as I move down here.
We should give a shout out to Allie.
Yes. Our Lane County TS built this for us. And so Courtney, who is a paralegal up in the DA's office, the data that she gets is what's here. So we've created, the state required us to enter data into what they call REDCap. We wanted our own data. So our data comes from the district attorney's office of Courtney going through all the police reports and all of the work in the case management. She collects all this data, gets it to Allie and TS, and then she created this dashboard. And so now all this information was the workload that came to Chris's office with House Bill 4002 and to case manage. And so to case manage people and keep track of their systems, this is the stuff that we're using. This all comes out of police reports. This is where all this information comes from. Then when we come down here, the breakdown of gender, age, and gender, interesting, go back to my time at the Lane County Jail. 80% of the jail is male, 20% is female. Our program is almost 50-50 with helping women and men. And so there's a lot of times that someone will get arrested out there and their partner is doing low-level crime, but they're connected to someone that's maybe doing felony crime. Law enforcement's offering this person deflection, where maybe this other person's going to jail on a felony crime. There are a lot of DV domestic violence situations out there that people are getting out of those dangerous situations and taking deflection. And a lot of the law enforcement referrals with no charges have been that population of people. When we scroll down here, it's just another way to look at the age, but also breaks down race over here.
And I do want to go back to Courtney Runkle for a moment.
Yeah.
I think one of the checks and balances that we have in place, one of the things that's hard to do is to measure who could have been deflected, but were arrested instead. And Courtney, I think, has developed a great relationship with all of the law enforcement agencies and makes the calls. If somebody looked like they were good for deflection, she will do an active follow-up with the individual officer to say, so tell me a little bit about, why this individual wasn't deflected, just to better understand what's going on, and to also continue to build the education about what can and can't be deflected in case there is a chance that the person could have been deflected and it hadn't occurred to the officer in the moment. And Chris, I don't know if you want to say more about.
Yeah, and in several instances, we basically overruled the decision of the officer on the street, saying, well, this person was eligible, should have been offered the program, and ultimately reached out to that individual separately and got him into the program. So that's been nice.
And it's been a lot of those situations, it's an ongoing learning curve too. where I've heard officers say, I didn't know we could deflect people with warrants. And so it's like, again, this is complicated. And what it's teaching me is it's ongoing training and communication with this new tool that's complicated. And there's a lot of education with law enforcement supervisors and leadership of them knowing when you can and when you can't as they review reports, knowing how they can train and develop their staff to use this new tool.
So staying, go ahead, Paul.
Comment? You know, one of the things that I've always been impressed about Lane County is our commitment to evaluating programs. And not only are we collecting additional quantitative data that Courtney is regularly providing and that you're seeing in these dashboards, but we're also collecting qualitative data. Were you going to talk about that at all, Clint, the contract with Oregon Social Learning Center?
Yeah, no, go ahead, Paul. Oh, that's a good one. I forgot all about it.
Yeah, so we've used a little bit of the funding to work with Oregon Social Learning Center to collect qualitative data to really help us better understand what's working and why it's working and what are the challenges. And so they're doing regular interviews with participants, with treatment providers, with the peer navigators, and with law enforcement. And we're just beginning to get some of that data back, and it's very rich. So all of that, I think, is helping the program make changes in real time based on kind of what we're learning as we go.
Yeah, absolutely. And then when they're done, they'll develop they're doing a study, and then we'll get a report at the end of that gives us all the data that came from that. Some of the things I've heard folks that have graduated from our program say, program saved their life. If it wasn't for the navigators, I don't know where I'd be right now. No one's ever helped me stay connected the way they help them stay connected. It's a lot of it goes back to the navigation and then the housing. I've never been offered housing to get to treatment, to be taken care of. It's not uncommon for the path to look like someone spent 30 days in our housing at Reveille, but they stayed 7 nights there. Because the first night they were there, they got sheltered. The next day we got them into Buckley to detox. 14 days later, while they're in detox, that navigator's working on getting them an inpatient treatment bed. So when they come out of detox, they got a place to come back to. 6 days later, they're going to inpatient treatment somewhere. So 30 days they were at Reveille, but not necessarily 30 days. That's the piece that I could never do as the jail commander, was release somebody somewhere to get them connected, to stay connected. So it was super important to me that we build this program to have exactly that, a landing spot for someone to go to all these other pathways. We've even detoxed people at Peace Health at Riverbend, which the hospital doesn't necessarily normally do that sort of stuff, but they know when they get done, they got a place to go back to. And we got a plan. A lot of places don't detox someone just to go back to the street. And so you detox someone when there's a plan of where they're gonna go. And the community's really supported us with this. But Steve Yamamori and the housing has just been, that's been the game changer for our program. So I can't say enough good stuff about our relationships with them. I think with that, questions? I don't know how much time we got. I know I rambled on.
You did great. You got 10 minutes left. I was
10
just
minutes.
getting a little nail biting there. Good job.
What did I leave out? You guys, I went over lots.
Your question, helping folks understand in kind of the enlightened self-interest in terms of what this is extracting, from the criminal justice system, and the fact that these aren't cases that then tax the entire justice system.
Yeah, it's been huge. I mean, I'd be lying if I said that one of the self-motivators for expanding the criteria initially was that I saw an opportunity for us to ultimately take these folks that we would send through the criminal justice system to put them on a probation that would require them to ultimately have treatment. By expanding the criteria requirements, or ultimately expanding our eligibility criteria, we could avoid having to prosecute cases, which is a bit of a necessity in our office due to staffing limitations. So there was a self-interested point for sure from my perspective, but we also know, and in talking as Clint and I met with the chiefs of police and the sheriff, you know, the number one crime that the Eugene Police Department goes out and interacts with on a day-to-day basis is criminal trespass in the second degree. It's almost always motivated by some level of mental illness, drug addiction, something of that effect. So if we could take that population of people and ultimately begin to address the root causes of their criminality, specifically drug addiction as designed in this program, we could effectively help these people and help take some of the burden off of society in that these folks are the ones that are the highest utilizers of all public resources, to include police and fire, but also our hospitals and park systems and things like that. So, you know, it has had a tremendous effect in that we have limited the number of cases that both us and the municipal courts have had to address through the criminal justice system. But I think also we've been very successful with this program. When Clint says that we had originally, I think we had an active conversation early on that if we saw 15–20% of people ultimately succeed in this program, we'd be thrilled, because that doesn't mean, that's higher than what we get when we send them through the criminal justice system, even with orders to ultimately do treatment in it. Most of those people that we send through the criminal justice system on a probation and put them there for the purpose, the primary term of probation being that you will get substance abuse, it's 10–15% tops that ultimately end up achieving sobriety for a long period of time. So that we're reaching 45% or better means that we're having some real effect, which is, of course, the goal, right? We're just trying to reduce substance abuse here in Lane County. And I think this program is ultimately having effect. And that it has some additional collateral consequences just makes it's gravy on top, if I'm being honest. So.
Great. Commissioner Park.
Well, you know, the real upshot of this conversation, we're talking about the effectiveness and the teamwork that's involved, the cooperation, coordination, and Chris, the things that you've done and what Clint says you've allowed. Really, the direction we have to go is for the ongoing funding, right? To demonstrate the effectiveness in Lane County. Other people are trying to copy us, but to demonstrate that effectiveness, we can show that more people are successful in this program than in a far more costly criminal justice system.
Yes.
So we're not only changing lives, that's what we care about, but we are actually making far better use of the dollars spent on people who are involved in the criminal justice system. That's the discussion for the future, is how do we continue the funding to make sure that you don't have to act and then be reimbursed. And to know that, Chris, you're on the CJC, and Paul, you're on the CJC, and Rob, you have all of those years of experience. You know, what can we do as a commission to help you make sure that that is that continues? And I'll look for direction personally. I'll also look at when I'm reporting your work, the dashboard makes it very, very easy.
Yeah. One slide that we did not include in the presentation, and I'm not even sure yet, though we've had discussions, is there is a quality of life component to it that we actually track, and some of the things that I decided we got to make public, because this is where the rubber meets the road with this program, is that many of these people come into this program estranged from family, houseless at the time that they were ultimately contacted, and when they leave the program, almost 100, I think it was 100% of them now, have rebuilt their connections with family and friends that they didn't have prior to coming into the program. Some 80-some% of them are now in permanent housing. Many of them have jobs. I mean, we're seeing, you know, this is what we would expect as a society ultimately for a treatment program, that not only are we helping them beat the addiction that is creating a humanitarian crisis out on our streets, but we are putting them in positions where they will, they'll have the best likelihood of having success going forward and into the future and become the contributing members of society we want them all to be. So it's a really cool dashboard that I think if we haven't included it yet, we will in the future, because it really demonstrates the impact this program's having long-term in these people's lives.
And that's what we need to report, is that success. Because
Exactly.
if people see the success, they get the salience, they taste it, they know what it feels like and looks like, how can you not support it? How can you not provide ongoing funding?
We got to get that slide on there because that also, a lot of folks that end up in jail, it's because their family has they've lost hope in that person or they don't know what else to do. A lot of times they turn to law enforcement thinking they're going to help them. The person goes to jail, they lose the support structure that they had due to their own chaos they were causing in the community and their family. And that does show the connection piece come back when somebody gets help and they connect back with their family to get a support system. And so you're right, we got to get that out there.
And it includes meaningful things like many of these people have been, disconnected from their children for a period of time. And we're keeping statistics on how many of these people have regained custody or ultimately have routine control now or contact with their children. That's a meaningful metric, especially to somebody, because when you get your support system back intact, it's going to give you a better chance of being successful going forward. So, and that's, getting back to the success of this program. I mean, I was a small part in helping to construct what was built here, but the heroes in this program, as we talked to the City Club, are really the navigators who are tenacious. They are tenacious in their efforts to keep people engaged in this program and to break down the barriers that exist for these folks in seeking treatment. And which is where the criminal justice system has fallen short for many, many years. We're breaking those barriers down and making it easy for these people to help themselves in the end, and it's working.
Do the navigators exclusively work for Ideal Option?
Yeah.
Okay, so that's where the contract lie. And, okay, good.
Yeah. And a big piece within that, the lived experience with really being where that person's been before is the piece that working with law enforcement and bringing that piece to the table is really beneficial. I know a few of you have been to our graduations that we have for deflection. I know we wanted to try to highlight that and just really celebrate the accomplishments of the folks when they were graduating. It's very moving. If you haven't had a chance to come to one yet, every time we have one, it kind of hits me in a different way that I didn't expect it to really hit me. And law enforcement told me the same thing. I'm starting to see more and more of the law enforcement community. We really want to see the officer that deflected the person come to the graduation if their schedule allows. But it really, for them, they don't necessarily get to see. They go from call to call to call of chaos. They don't ever get to see 4 months later how something played out. And so to see it come full circle, it's been a really neat experience for us involved in the program, but also to see law enforcement, how it makes them feel. And that person typically thanks them for making that phone call to the navigator to deflect them. And so, yeah, if you get a chance, we'll make sure we keep sending that out so you have it on your calendar.
Commissioner Buck, please.
This program is, I think, more successful than I even anticipated. We already knew that it had a great potential for success, but I think the statistics that you're showing are bearing out that it's even more successful than originally anticipated, largely because we're so flexible and you know the program so well and your history, and that makes it ingrained with the other systems in public safety and services that perhaps other counties just don't have that capacity. And sometimes when it comes to these kinds of programs, it can heavily rely on the people who run it and their energy and their knowledge and experience, which you have in spades. So I want to really thank you for your commitment to the work, because I think in large part that is what's really driving a lot of success, including the navigators, and including our DA and how we're all really integrating the work together. To your point, where we need to ensure that we're continuing to get the resources for this really successful program, I think the question goes to how do we get this in front of legislators, because they're really the ones that hold the purse strings to this program. And being able to demonstrate individually to them when they're not in the middle of session, including the quality of life that you were mentioning, is probably really going to be key to us maintaining and hopefully over time increasing some resources to that. So I know that's yet more work on top of the actual work. But I think, as a board, we can play a role in helping to facilitate that too, trying to think of more ways in which we can be as supportive as possible.
If I could just add, it's, so I came here to Lane County only 5 months ago, but was part of the architecture of creating 4002 and the whole deflection program. But to answer your question specifically, I think we have not only legislators from Lane County, but legislators from Oregon who are in charge of the money, who are true believers now, including a co-chair of Ways and Means who was part of the work group, the small work group that built 4002. So she's now making decisions, and I can't speak for her, of course, but she's sold on this because of the data we're seeing statewide. The data out of Lane County is phenomenal. As a policy wonk, I want to encourage us to make sure we disaggregate this data and share it, because quite frankly, deflection itself stems from two different paths. One out of the mental health world called sequential intercept model. Won't bore you with, it's a long story. This is SIM1 for those that are behavioral health wonks. And from LEAD, law enforcement assisted diversion, which is a precursor to deflection. Exactly what Clint was saying, we were expecting, really, if we were getting anywhere between 15 and 20% success rates, that was great, because deflection is just the first of 4 off-ramps we built into House Bill 4002. And to see the stats that we have is almost, for a policy wonk like me, shocking. So we need to share this data. The one thing I do see different, not only is our program different than a lot of others in Oregon, but it's fundamentally different than others that the model was built upon, in that 31% that we take that aren't even going to be criminal justice involved. We need to make sure we have the ability to quickly disaggregate that out, because people say, well, you're allowing people in that aren't even going to go into the system, and so you're going to see higher rates. I think, actually, if you disaggregate it, it'll prove that theory wrong. I think you're going to see these phenomenal rates. It's really still too early to put the flag of ultimate success in the ground, but the preliminary data we're seeing around the state of Oregon, especially for Lane County, is, I can't speak for everybody in that room, is phenomenally higher than we ever anticipated. So it's just, quite frankly, just stunningly great news.
But one little piece too, it was kind of neat. We studied the LEAD model. It was created in Seattle in 2011, and that's the model that we took to use this one. Seattle worked with me really closely with the LEAD Bureau, and I went to a few conferences, and they've been a great partner. They actually came down a couple of weeks ago to look at what we were doing down here because of the stuff that they were hearing about our stuff. But the credit goes to them, because they built the first model, and we used that model to try to see how that could work here. And so I learned more from them than they did from me, for sure.
And now it's payback.
Yeah.
And Rob, to your point about disaggregating the data, we've actually done that. And Clint, correct me if I'm wrong, but the success rates are higher for people that have charges than for those that don't. So, you hit the nail on the head, and that is data that we are looking very closely at.
Well, congrats to I can't take credit for any of the Lane County stuff, but big congrats to everybody involved in this.
Big Ben amazing partners. All right, great job, everyone. Great leadership. Your leadership obviously is superlative based on the results. The challenge going forward in just 5 months of this is to create leaders like yourself that will replace you someday. There's the challenge ahead of you, yeah.
All right.
All right, thank you
Accepted.
again. There you go. We will recess to our afternoon session at 1:30, meeting right back here at the Board of County Commissioners rooms. We're recessed.
Thank you.